everyone.
Hi, guys. Hi, Amy.
Now, Diana's got perfect lighting there, and I look like I'm sitting in the dark, even though it's night where you are, Diana, and it's morning where I am.
Yeah. No, I could see you pretty good, though.
Yeah. Okay. Well, you know what? We don't need the full-on detail anyway, because then you might see the fine lines. Anyway, nice to see you, Diana. You're finally on my channel in person.
Yay. I love your intro.
Yeah, I was kind of excited about that. I wanted Daisy in it, definitely. And definitely with you guys in it too, because you're my faves.
Oh, yay. I can see the chat now. I wonder if I can chat from here, too. Let's see.
Yeah, you should be able to.
Oh, yeah, I can. Cool.
Yeah, there you go. Hey,
I'm
Phoebe,
excited.
you know, all the mods are here. That's good. That's a good show. Did you see that I had a reference to you in the Toolmark video yesterday, Diana? Your shoes and my shoes?
Yes. Did I message you? I'm 7.5.
Oh, you're way short. You're way smaller than me then.
No. I don't know what shoe size. I mean, I don't know how they use sizes in over there for the shoes.
I think we use American sizes, so I'm American size 9. I used to be 8, but after babies, my feet got bigger.
Oh, wow. Okay.
To get rid of all my shoes.
That's a bummer.
Anyway, okay, so I always feel nervous when I'm doing these. You've just realized who Daisy is, John Paul. Oh, there you go. Yeah, Daisy, Amy G, same person. Amy G, some people call me whatever you like. Do you know that Britney Spears song, If You CK Me? Oh, it was like a big hit back like when I was, well, not much younger, but like probably about 20 years ago. And yeah, anyway, I was just like, it's like love me, hate me, say what you want about me, but all the boys and all the girls. I won't say the rest of it, but anyway, don't worry.
I gotta hear this time. I'm really bad with remembering names of songs and who sings them, but as long as it's not a recent Britney Spears, then I'll probably know it.
No, it's like, oh gosh, when would it be? Like 2009 or something? Yeah, I just thought of it the other day, and I was like, it was just funny when it says like, love me, hate me, say what you want about me, and I was like, oh, that's so cool, and I'm Amy. Anyway, okay, let's get into today. So, as much as I'd love to sit and chat, because it's fun to chat with you, Diana, I haven't chatted with you for a while properly, face to face. Today, we are going to start a series of videos, which is the Psych Panel's input on Richard Allen. And the Psych Panel actually is already recorded. So the Psych Panel is 3 psychologists, myself and 2 of my colleagues. But we're bringing in another psych here, Diana, who is also going to add some of her commentary as well. So we've pre-recorded the video, and we're going to play it, but Diana and I can pause it and talk about it as we go along. Today's part is just about analyzing Rick and understanding him as a person prior to incarceration. So we're not looking at confessions today. We're not looking at guilt or innocence. We're not looking at any of that stuff. We're really just looking at the background information about Rick, what we know about him mostly from Westcott's testimony, and also looking at some of the interviews and interrogation videos. I don't know, do we call them interviews or interrogation videos? They're kind of both, but just getting a baseline of like who Rick is. Now, big disclaimer at the start. Always have to have the disclaimer. Today, I don't have to have the disclaimer that I'm not an expert, because I am actually an expert in clinical psychology. I'm going to own that. I've been practicing for 15 years, so I think that gives me expert status. But I'm not, none of us, myself, Diana, and the panel, none of us are trying to diagnose Rick or say that we know him. None of us have met him. Right? All we're doing is providing commentary based on publicly available information and testimony. We're making observations. You do not diagnose someone based on watching videos and reading information, but you can make some observations and some suggestions about what might be going on. So just making that disclaimer before somebody says that I'm trying to say that I'm best friends with Rick, because I'm not. I mean, be happy to chat to Rick if he wants to chat to me, but he doesn't. Okay. Well, not that he doesn't. He doesn't know who I am. Anyway, okay, so Diana, would you like to tell people a little bit of your background, like just a tiny, tiny little blurb about like your career?
Sure. Let's see. I kind of fell into psychology in my undergrad. I didn't even know what psychology was or how to spell it. And then once I learned about it, I wanted to take it as far as possible. So after my bachelor's in Virginia, I moved back home to Miami, Florida, and I went to Albizu University there for my master's and my doctorate. And I got my master's in 2012, my doctorate in 2017 in clinical psychology, and started working as a therapist in 2012. I don't know how many years that is.
At 13, yeah, similar to me then, yeah.
And then moved over here to Oregon after I graduated and just started my private practice where I work at home and I see patients for therapy online, just like this.
Oh, okay. So do you do any face-to-face or all online?
All online. I mean, this technically virtual face to virtual face.
Yeah, okay, cool.
No phone therapy. I cannot focus for
no.
phone therapy.
No, I'm with you on that. Absolutely. Excellent. Well, I mean, anyone on this channel possibly knows a little bit about me, but I guess just to give a really, really quick blurb, because once we start the video, you'll hear about the other people on the panel. So I graduated in 2011 officially, but I started working as a clinical psych, as you do within your postgrad training. So around 2009. And when I graduated, I was already working in a forensic facility as a treating clinical psychologist. So I wasn't doing the forensic aspect, the offender programs, but I was doing like suicide reviews and treating anxiety and depression. And yeah, I got to be what officers used to call a bleeding heart. So I'm the person who the inmates really liked because I actually gave a damn and wanted to talk to them about what was going on in their life and help them with anxiety and help them kind of figure out stuff, keep them safe. A lot of inmates that I worked with were really vulnerable, like Rick, and needed support in making sure that they were kept safe in custody as well. So that was my first job. And then since then, I've worked in hospitals and now work in private practice. So full time. Okay, anyway, that's probably enough. You guys don't need to know my whole career history, but we are actually qualified to talk about psychology. That's the important thing.
I was going to say working with inmates that's a special type of therapy you have to do. You know, they're a special population and have different issues than, you know, people like us who are on the outside. So that's cool. I didn't know you did that.
Yeah. So I actually it's a funny story. If anyone wants to hear the stories too, I guess I guess you want to get to know us. So when I got the job in the jail, I thought it was going to be a women's jail. So it was a jail that was just opening, and they talked about it being a women's jail where we'd be doing programs, you know, women's violent offenders program, sex offenders program, and I rock up there and they've decided it's not a women's jail. They've canned that. It's a men's jail, maximum security, medium security, and minimum security. And there is me, and I was a very naive person in my 20s, wearing my puffy sleeve pink tops and, you know, with my floaty curly hair, and like I was just like so different. And I walked in there with the person who started the same day as me, and she was a lot tougher than me. She'd worked in probation and parole, and you know, she just had more of a toughness about her, dressed in all black, you know, just very much more fit the scene. And I was like, do I need to adjust how I am, because like this probably doesn't fit here? But I didn't, because I can't be inauthentic. And yeah, it was kind of funny to begin with, because I definitely did not look the part. But the inmates, I think, actually appreciated that I was actually just genuine. Like I wasn't trying to be this tough person who I wasn't. And I ended up making lots of good connections, and the inmates would refer their own friends to see me. So I'd have like an armed robber saying, "Can you see my mate too, miss?" Like it was just so cute. They were like, I really had a great time.
That's awesome.
Yeah. I was just reading the chat for a minute. But anyway, yeah, so I really liked working there. There was, you know, I guess, I mean, I worked a majority of the time with people who were convicted and probably were guilty of the crimes that they'd committed. But still were just really wounded souls that needed a lot of support. But I don't think that's the case here with Rick. I don't actually think he's guilty, which adds another whole layer to his experience. Anyway, without further ado, we might start the video. And if anyone has any questions or wants to stop along the way and get some info from me and Diana, let us know in the chat. Diana, if you want to stop at any point, and I will stop and put you on the spot and ask you questions anyway. But if you do want to stop at some point, then yeah, you let me know as well.
Okay, if you ever see my avatar pop up, that means Valencia's calling me. Everybody knows her here. And I'm going to grab a coffee. So I'm going to put that avatar because I have not had coffee today and it's almost 6 p.m.
Well, you need that.
But Amy, that's awesome. I didn't know you did worked in forensics. I did not explain where I worked, but I do not have forensic psych background. All my best friends, they were all forensic, but I went the more of the neuropsychology route and did hospitals and stuff. So Amy, you definitely have some experience there. That's cool.
Yeah, there you go. There you go. Now, just before I do start the video as well, so the two psychs on the panel are my colleagues. We do all work together. They are senior psychs as well. And they don't know a lot about the case other than that they're my friend and they hear me go on about it because, you know, I'm a bit obsessed with this case. So they do know that I believe Rick is innocent, but they don't have a whole heap of background. And I wanted it that way because I wanted it to be like almost like a blind panel where they didn't have any preconceived notions about him as a person. So you're getting kind of their raw reactions. There are times where they start asking questions because they don't actually know anything about the evidence and stuff, and they got a bit more interested over time. But yeah, just wanted to give you that explanation before we start. Okay, I'm going to play the video. Diana, we can put our avatars on and we can go to sleep now.
Okay, sounds good. I'm not going to sleep, but where's my avatar? Boop.
I'm going to introduce you to my panel. So maybe we'll start with you, Ashley. Would you like to tell Oh, just one thing as well. The panel is not going to look particularly interesting because none of us actually put our faces on camera. The reason for that is I didn't actually want to subject my colleagues to any kind of bullying or trolling like I've had. This isn't their area of interest in terms of like true crime. So they were willing to come on here, but I didn't want to like publicly flash their faces and hold them in a position where people might dox them or anything like that. So that's why it's a little bit boring, but like in terms of the visuals, but hopefully the content is what we're here for. Audience, a little bit about you.
Yeah, so I'm Ashley. You can call me Ash. I'm a clinical psychologist by training. I work in private practice, so I see mostly adult clients. Had a little bit of experience working in like forensics, but that was a long time ago. That was like before I was getting my psychology registration. So that was, probably more than a decade ago now. When I was doing more case management, that was more to do with people who were charged for crimes and were remanded to, have their mental status checked to see if, that had any contribution to the alleged crime that they committed. So so I wasn't kind of like directly doing the assessment, but I was involved in some of those assessments that were done. Yeah, but I'm not doing a lot of probably almost close to non-forensic work now, but that's been helpful to have that background. What I do mostly now is seeing clients for therapy. So clients come voluntarily, and my interest areas in trauma, and also in neurodivergence, so working with people with autism and ADHD, having different brain types. And trauma-informed practice, like that's really the interest area that has been there for me for quite a long time, which I think informs a lot around, just how people show up, whether they feel safe or not, and depending on the history as well. Yeah, so I think that should be enough about me as a gist, unless there were any more questions.
Yeah, and I guess really important point to note for our audience that the overlap between forensic and clinical psychology is about 70%. So we study pretty much the same stuff. Most forensic psychologists practice as clinicians, or not most, but a lot of them do. And a lot of us clinical psychologists do forensic work. And so even when Ash is saying she doesn't do any forensic work now, I'm sure you do write some reports for your clients sometimes, you know, treating psychologist reports and things. But yeah, like we're not predominantly working in that area now, but you've had some good experience. I mean, yeah, that's definitely relevant to the conversation today.
That's true. Yeah, like kind of understanding personality disorders, or how that was being diagnosed, and sort of having to do that differential diagnosis. How much of it is mental health, and how much of it is sort of more long-standing, traits, I guess, that people might possess. Yeah, and kind of trying to differentiate that.
Yeah, for sure. And just a note as well before we get to Mel. So Dr. Westcott, who we're going to talk about a little bit later today, and Dr. Wala, they're two of the psychologists who did evaluate Rick Allen in this case. They're both clinical psychologists. So they have a doctorate of clinical psychology, but they've obviously also practiced in forensics. So that's a lot of us. Most people who have listened to me before know that I've worked in the jail setting, again, also about 10 years ago. Over 10 years ago now, but I was a clinical psychologist as well. So you don't have to be a forensic psychologist to work in the forensic setting. Okay, but let's go to Mel and let's find out a little bit more about Mel.
Thanks, Amy. I'm Mel, and I am a clinical psychologist registrar, and I work in a private practice like Ash and Amy. And I also work, along with working in private practice, I also work at a facility there. I do work with forensic clients who have been referred to us by the forensic facilities. Yeah, my role isn't necessarily to do any kind of assessments, but it's mainly to manage and also, I guess, do risk assessments and put safety plans in place. Yeah, that's me. I don't know, Amy, Ashley, do you have any questions?
No, I think that kind of covers us all. So we're all actually pretty experienced clinicians. I've been practicing for 15 years now. Yeah, I mean, that's including internship as well. What about you, Ash? How many years now would you say you've been practicing as a psych?
Yeah, well, as a clin psych, that would be, let me see, after the master's training, that would be probably my 6th year now, I would say. I was working for another 5 years before then, and that was where the forensic experience, among others, came in. So yeah, I guess overall, 10-ish years, but just specifically in psychology, that's about 6 years. Yeah.
Okay. And just when I was advertising what we were going to do today earlier, I already introduced you as one of the most intelligent person I know. So.
Okay, that's a lot of pressure.
But yes, I think all three of us are highly experienced and intelligent women. So I think we're a good panel. Mel, how many years of experience do you have?
So as a clin psych registrar, I have been, I would say, about 3 years. But as a registered psychologist, I've worked for about 15 years.
Yeah, that's right. Because I was just going to say, we all work in the same clinic, which is an award-winning clinic. I love saying that. Mel is a senior psychologist there. Yes. So it's just this thing around our clinical training and registrar programs. It's just something in Australia, the way that they kind of do it is that you can have a lot of experience, but you just have to go through these particular steps to get the formal accreditation. But let's get into the case. So like I was saying, I've told the ladies a little bit about the Delphi case and a bit about Richard Allen, not at all the detail that I myself have and most of the people who probably listen to me have, but that's okay. We actually want them to go in with less of the information because that can bias people as well. So I really wanted this panel as an opportunity to get the views of people who've not been biased by any of the coverage. So yeah. That was kind of the point of this. So I'm going to try and not offer as much of my opinion today because people can hear that anytime on my channel. And rather, we're really going to see what Ash and Mel think based on, just the introduction to this case and just looking at the testimony and the confessions and the videos and things like that. So I'm going to just try and facilitate the conversation. I probably won't be able to help myself, but say certain things, but I'm going to try and take a bit of a backseat because, like I said, I can record this. I can record something about my own views anytime, and I've written my long 34-page report that's out circulating as well. Okay, so there's multiple layers when we come to the psychology in this case. We've got so many avenues we could explore, but the main things we're going to do is we're going to try and understand who is Richard Allen, get like a historical background, a mental health history, what was his life like up till October 2022 when he was arrested, what was his life like up until February 2017 when the crime occurred, and then we'll do post-arrest and incarceration where we look at what happens as he does decompensate. So spoiler alert to Mel and Ashley, but yeah, when he decompensates and when he confesses, I think it's 61 times, guys, but again, that's later down the track. We may need to do this in 2 parts. So as we're recording this, I don't know if we're going to finish this all in 1 part, but we'll try. Otherwise, we'll schedule a part 2. So without further ado, if you guys have any questions, Mel and Ash, about the case as we're going, feel free to ask me. So I'm going to just read out the information that Dr. Polly Westcott, who was the defense psychologist who was used to assess Rick Allen when he was incarcerated, what she obtained through doing extensive file review, watching video surveillance of him while he was incarcerated, and interviewing him and having one of her assistants do the neuropsychological testing. So I'm going to give you all of that information, but I'm not going to tell you what her conclusions were in terms of diagnosis. So I'm going to just eliminate those things, and you're just going to hear the kind of background information and some of the results of testing. And I want to then pause and get your thoughts. Okay?
Yep.
And so for my listeners, this is, it might be going over old ground if you have already listened to coverage of the trial or read the transcripts, but there's volumes of transcripts, guys. So the chances are they may not have. I know even for me getting through the psych transcripts, it was like hundreds of pages. So Dr. Westcott's role, so she was doing an independent evaluation and neuropsychology. So she was reviewing the mental health history pre-custody and in custody like we're doing now. She conducted neuropsychological testing. She had an assistant that did that, but she interpreted that. And then she offered a 127-page report, which we don't have, but we've heard parts of it during her testimony at trial. She spent about 2 hours with Rick Allen. So this is in August of 2023. So just a bit of background, Mel and Ash. So when Rick did decompensate while he was in custody, so he was arrested in October, late October, and he initially was doing okay in custody. And then around April of 2020, so that's about 6 months into his incarceration, is when he started confessing and showing indicators of psychological decompensation, which we'll go into a bit further later. So by the time Dr. Westcott is assessing him in August, it's after he's decompensated and he's been treated with antipsychotics. So he's somewhat, I don't know if he's back to pre-morbid levels. We'll talk about that later, but he's not floridly psychotic, okay? So let's get into the summary. So Rick Allen is a man who had an extensive mental health history. So from the time that he was a child, based on her interview with him and talking to his wife, Kathy, and looking at medical records, he remembers things like having intense difficulties with anxiety going to school. He had intense fears that he couldn't control his worrying and that he would go to school and then never come home. He had intense fears that something bad was going to happen to his family when he was separated from them. He had intense anxiety around other people and feared that other people were looking at him and thinking of him badly, even if there wasn't evidence for that. He was always very concerned about what other people thought of him, And so that made him a little bit more closed off. He kept to himself because he had such concerns and worries about what others were thinking. And so this worry about what other people think of him was ongoing into his 50s. So as well, just to let you guys know, so he was arrested at age 50 and the crime occurred in 2017. He would have been age 44 at that time. So into adulthood, he continued to have anxiety and it became really difficult, very prominent. And so he starts medication in his 20s. He starts it at first for anxiety, but then over time, there's pretty severe depression that comes into play. The depression is, and this is in her words, really a reaction to the anxiety. He can't control the anxiety. He can't control how he's feeling around other people. He's constantly thinking that he's failing his family, he's failing other people that he's working with. Again, in reality, he's not, but that's how he's feeling. And then he feels worthless and he feels like he's not able to provide for his family. He's sure that other people don't like him. He often wishes that he would die. He often hurts himself. And so just to give some context, Rick married Kathy quite young. I believe it was early 20s. They have a daughter. So at the time that he's arrested, his daughter's in her 20s and she's moved out of home. He lives in the local area of Delphi and has worked around that local area more recently, but also within the Indiana area for longer. He has steady employment as a pharmacy technician. So what that means is not a pharmacist, but, like the person who is, it's like the customer service role. But he's in a supervisory role. He's previously worked at Walmart. So he's worked a lot in retail and always ended up in sort of supervisory type positions or management positions. History of steady employment. Relationship with wife is reported to be good. She stood by him and does continue to this day. So no indications of any issues with family. Close to his mum. Dad left when he was, I think, an infant, but mum remarried and he refers to his stepdad as dad. And they subsequently had another child. So he has a sister who he grew up with as well, who's a few years younger than him. I'm just going to go back to a little bit more about his mental health. So in his medical records, between his 20s, all the way up through to when he was incarcerated, pretty frequently being seen for medication evaluations, reporting symptoms of depression and anxiety. They vary in terms of their levels of control. One of the things that's a factor in terms of his anxiety and depression is that he has a pretty clear-cut history of when there are what she calls external stresses. So things in his life outside of him happen as a stressor. Something happens, puts additional pressure on him, stress on him, and he kind of crumbles and falls apart, quite literally, curling up in a ball, crying. Most of his anxieties in adulthood revolve around two concepts. Work, he feels like he's failing at work, that he's letting other people down at work, that he's not doing his job appropriately, that his own internal experience, this is his own internal experience and belief. When you look at his work history, he's had essentially 3 fairly long jobs, 9 or 10 years apiece, where he's loyal, responsible, he does the job, people like him, they promote him. But when he's promoted, there's more stress on him. He's expected to actually tell other people what to do, which is something that causes him anxiety. He worries that if he tells somebody what to do, they're not going to like him. And then he crashes and the depression comes on. So the companies like him so well that they keep him on and he ends up working for several years. So the pattern happens 3 times where he stays within the job. They're not letting him go, but every time he kind of rises to the top and he's in a management position, he can't handle the stress of it. And you see it all over the place where he's at home again, kind of crawling, curling up in a ball, crying. So they end up keeping him on, but they'll allow him to demote himself essentially, but they still want him to stay on. His plays a key role in kind of putting him back together and making him feel good about himself and kind of sending him back out on his way. And so, as I said, the work is usually really understanding. They allow him to be demoted, but still keep him at the job. But even in lower positions, he's still having anxiety and depression because seeing himself kind of fall from that position also contributes to feelings of I'm worthless, I'm not doing well, I'm not providing for my family. So a bit of a history there of a trigger for him. In terms of family history of mental illness, they weren't allowed to talk about that at trial. That was considered hearsay, so I can't give you any background of that. a side note, and this is my interpretation, but, I guess Dad leaving the family when he was an infant, sometimes to me that speaks to maybe Dad having some of his own concerns, but it's hard to know. That's my interpretation, guys. Was there ever a time, I'm just reading some of the questions that were asked of her, was there ever a time in Rick's adult life when he was not suffering from depression and anxiety? And she said, I'd say there's always a time where he's suffering at some level. There's a spectrum for anxiety and depression. There's always some level of anxiety and depression. There are periods of time where symptoms have improved. Usually that's when medications have been switched around or there's been a change in his work environment where there's less of a demand or perceived demand for him. There was one point in time because of his job that he lived away from his family, which was also a point in time where he kind of crumbled and wasn't able to maintain his mental health. But once he reunited with his family again, they were a strong support for him. So I'm not going to go into the next part just yet. Let's stop and have some thoughts. What sort of ideas are coming up in your mind about Rick? Okay, Diana, I'll ask that question of you first. What sort of thoughts are coming up in your mind about Rick when you hear that?
He just sounds like an average guy. Obviously diagnoses are flashing through my brain, so I'm seeing like some ADHD stuff. And he obviously was not treated for his mental health because with his jobs, when he gets to a point to where he needs to step down, right? That probably wouldn't be happening if he was properly treated, right?
Yeah, for sure. And I think, is there an echo when I'm talking, guys? I can hear an echo, but maybe not. So yeah, I guess what I'm thinking as a clinician is that this is a man that's got to the age of 50 when he is being interviewed, and he has been suffering with anxiety for his entire life to a level where the depression has got so severe that he's ended up, being suicidal. I think it was in 2019 that he ended up in hospital. So this depression has not been well treated and well managed, nor has the anxiety. And so what that suggests to me is that there are more layers here. He was treated with fluoxetine, which generally speaking, SSRI medications can be quite effective for generalized anxiety and depression. I mean, they're not the cure-all, but they certainly usually can make it more tolerable. And so when we've got this man who for decades is still struggling, despite having, a stable job history, despite having what seems like a really loving relationship with his wife, family support, there are no obvious triggers in his life. There's nothing really traumatic kind of going on that we can be aware of. So to me, that does suggest more of a sort of neurotype kind of related stuff, like he is a highly sensitive person, and I think that there are angles that have probably been missed when he's been treated over the years, and when we are not getting at the underlying issue, then we're not necessarily going to see a whole heap of improvement. So yeah, I'm with you, Diana. I think things like ADHD, ASD, something to do with his nervous system being highly sensitive, which I guess comes up later when Dr. Westcott says a fragile egg, which realistically I don't think is the way you should describe it in a legal setting or in a report. But yeah, that's my sense too. Anything else you want to add, Diana?
Side note, Australia published that beautiful study about SSRIs. Do you know about that?
Which one's that?
I think it was about 3 years ago, and basically since we've been doing it all wrong, SSRIs, they don't really know how they work. Yes. They don't even know how depression works, so they kind of we've been doing it all wrong basically.
Yeah, so is that the one where they talk about the brain chemistry thing, where it was actually, yeah, maybe it doesn't sort of match up with what the theory was around serotonin and things like that. Yeah, I mean, absolutely. And I think that it seems in Rick's case that the only thing that was done was medication all these years. That seems to be the only thing we're hearing when they talk about how he was treated. So yeah, I think that he would be a really good candidate for some more intensive therapy, which he's obviously not getting while being incarcerated. Okay, should we listen to what the others have to say?
Yeah, sounds good.
I mean, probably just generally, like, that long-standing anxiety and depression would make me think about, this is someone who probably has quite a I guess what we call like a highly sensitive person kind of, neurotype or brain type. Doesn't say what it is, but, I mean, it's definitely, a person who is very much affected by their surroundings and their interactions with others, relationships. And it's hard to say with that little information, but I was thinking, like, from that sort of like trauma frame as well. If, someone has had, I guess, attachment disruption, I was referring more to maybe, partly father passing away when he was that young, but also how things were like for the rest of the family when that happened. I think that
Actually, father didn't pass away, he left.
Oh,
So
sorry,
he
he
left.
left.
Yeah,
Okay.
he abandoned the family essentially. So
Yeah.
his stepdad
Right.
is. So yeah, you're still on point though with.
Yeah, sure. I guess, yeah, either way, it doesn't really kind of make,
Yeah.
one doesn't make the other, like,
No.
worse, but it does say that there has been a disruption in the family, and so there would have been an impact anyway, regardless of how big or small. So I'm curious about that, and I do wonder how much of that has also impacted on Rick's, I guess, way of coping with life later on, because we know that early on in life, like things that happen very early on, the earlier it happens, the more likely it's impactful, because something that happens to a very young child, it doesn't need to be a big thing to an adult, but it's going to impact them a lot more than someone who's
Yeah.
Yeah.
Mel, anything that you wanted to add?
Yeah, look, I'm very much, I guess, tagging on to what Ash said about that whole trauma framework. But I guess I have more questions. You mentioned that, very early on in his childhood, he was observed to be quite highly anxious. And I was just wondering, was this picked up at school, at home? Was any supports or help provided to him? What was their understanding of this intensity of anxiety, that the onset was anxiety, and later on in his 20s, I guess it, secondary diagnosis was depression. So just wanted to get a bit of understanding around, how he was at school. And I don't know whether that information is available to you, Amy. But yeah, I was very curious about that.
Yeah, no, unfortunately it isn't, because yeah, we only have what was sort of testified to. Unfortunately, they don't release the full report because of confidentiality as well. So it's really tricky. It's so annoying because we're trying to like decode a puzzle. Because that really, really good point, actually, Mel, that you just mentioned, because that might also tie into how he copes with it now. I kind of think of, Rick, I'm trying to think what year he would have been born in, but it's like what, like 70s, I'm guessing, in the 1970s.
Yeah, pretty much.
So you kind of wonder, like, was like the mental health services for children back then would have been quite different. So if he was refusing to go to school or anxious, he probably didn't even have CBT or anything back then. So CBT for the non-psychs out there is the gold standard treatment for anxiety, particularly childhood anxiety, cognitive behavior therapy. So you wonder, like, did mum allow him to not go to school, or, was he forced to go to school anyway? I mean, his mum, and, this comes up in terms of when we look at his family, his mum is very supportive. She's also been at trial. She calls him, she's supportive. So is his stepdad, so is his sister and his daughter. Everyone in his family have banded around him. No one's turned their back on him. So it's hard to know, like, does... And we know also that Kathy, his wife, does look after him a lot. She props him up. It's a very close relationship. They've been together for such a long time, sort of almost like high school sweethearts, I think. But yeah, really important question. And I don't know, again, I mean, I'm going to insert my own opinion. I like what Ashley said, the highly sensitive person. Absolutely, we've got this highly sensitive nervous system showing up when you have a child at the age of school age, early school age, already being highly anxious about going to school, worrying about bad things happening, to the extent that it gets mentioned in a report. That shows that it's not just sort of developmentally appropriate kind of average anxiety. It's out of the more. And then we also get this consistent theme of feeling unliked. And as a neurodivergent person, to me, that was where I started to think, there's some elements there. It's hard to know, of course, we're just speculating, but yeah, it definitely seems to be something that I'd have a question mark over.
And I guess, just also thinking, if we were to think about this similar presentation in current day and age, I take it that, that was the 1970s, but if you take it in this presence, how would schools or families respond to that? Would it just be considered as anxiety, or would there be some other considerations to this kind of a presentation? If you have a boy who is highly anxious, school refuser, he's has this excessive worry over what would happen to him and his family, and those, you might start thinking what else is beneath the surface, apart from what appears as masking as anxiety. Yeah,
exactly. As a child psychologist, absolutely. Like when I see a child that young and that sort of debilitated by anxiety, we're looking at screeners for other like neurodevelopmental issues. Obviously, definitely would look at attachment and trauma history and things like that too. I guess, what we see, and this is just me adding some more of a perspective from knowing a little bit more about some of the dynamics in the case, is again the mother-child relationship here. There's a call which we may hear later when we're looking at confessions where his mum says, "I love you no matter what," like a lot of warmth between them. So to me, attachment to mum seems pretty solid. I mean, that's obviously looking at just a very small snapshot and in adulthood. But I think I don't think in the 70s anyone would have looked at neurodivergence the way we do now. Let's be honest. I mean, even when we were kids, no one did. I mean, I don't know about you guys. I know we're all slightly different ages, but I know when I was a kid, I didn't know any kids that had ASD or ADHD because it just wasn't diagnosed and it wasn't seen. And as somebody who was subsequently diagnosed with ADHD in my 30s, nobody ever would have guessed it back then. And I was a highly anxious, child as well.
I think if I can just speak to that, because I work a lot with neurodivergent people and also being neurodivergent myself, I've got more than one. And what I have noticed is that, there are, I grew up in, I went to school like in the 90s, and not in my school, but, what I was aware of, like the kids that got picked up were the ones who were very externalizing in their behaviors. So when they, act out, had like, I guess meltdowns or, I don't know, bouncing around and can't sit still. Like it's that sort of more overt behaviors that get picked up, but more often than not, in my experience, and also kind of what I see then the trajectory that carries on, what we call, I guess, high masking, when someone is really anxious or worried about, doing the wrong thing, they tend to hide, those behaviors because they don't want to get into trouble. And then we see sort of like the opposite where, more often than not, these kids then probably won't get picked up because, if they're generally well behaved, even if they're struggling on the inside, that is seen as like a well-behaved kid, and so they shouldn't have any problems. Like that sort of very simple way of like kind of how teachers would respond to a class of like 40 kids. So that's kind of like something I'm thinking about. The other thing I was going to mention when as the both of you were talking is that it is there's a possibility also that regardless again of what Rick sort of was going through like internally, but I would think that if he was that highly anxious, the other kids would probably pick up as well. Like this sounds like someone, just even hearing that someone who's quite like low self-esteem, has quite low self-esteem, and also just very concerned about what people think, like that was mentioned, right? So I would be thinking that kids are a lot of things happen unconsciously, but kids can pick up like which other kids are different. Sure. And I wouldn't be surprised if he got bullied, even if it's either overtly or even covertly. And being a boy as well, I think a shy and anxious boy, I think that there's even more layers of that that does kind of impact.
something else as well. So Rick Allen, as an adult, his height is about 5'4", 5'5". And the reason I mentioned that is, I wonder if he was a small child too, because obviously that's quite a lot below the average height for men. I believe the average height for men in the United States would be about 5'10", maybe, I think 5'9", 5'10" at the lowest. So that's quite significantly shorter. Anyone who's actually been in the courtroom when Rick has been there has said, it's quite obviously smaller in stature. So, I mean, being mindful, he did lose some weight when he was incarcerated too. So he would have looked smaller in frame. But yeah, I wonder again, and we think about kids, and I work with kids who are smaller in frame, and boys particularly, they do get picked on. They absolutely do. Yeah. And then one other point that I wanted to raise, just giving you a bit of background about Rick, is that he had a heart attack at age 37. Now, again, I think that's something that is relevant, because you wonder, with someone with a highly sensitive nervous system, we know that brain body connection, and you kind of wonder, was that a consequence of decades of heightened stress? Now, there could be genetic aspects here or whatever, but I'm just it's something else to kind of pay attention to, I guess.
Yeah, I can speak to that just a little bit. Quick point, but there is the ACE study, which is the Adverse Childhood Experiences study. It's a huge research that was done, I think almost like population-wide. I can't remember exactly. Don't quote me on the numbers. And they did an update recently. But what the ACE study actually shows is that the impact of childhood developmental trauma or highly stressful experiences, especially if they're chronic, do have an impact on a person's health, and not just mental health, but also physical health. So it's really quite, that whole, like metabolic syndrome and, more chronic like health disease, autoimmune problems. It's kind of one of those things. It's not saying that it's a definite. It's not like 100%, but we look at it population wide. There is really a significant.
It's interesting. Yeah. Well, I mean, it's like we most people who are interested in psychology will know the book The Body Keeps Score, Bessel van der Kolk. So we know that trauma is absolutely held in the body. Your nervous system isn't just your brain; it runs throughout your entire body. And I guess the other point I was going to say here is that, and again, we'll see what you guys think when you see interactions between Rick and his mum and his wife. He presents as very caring and very protective of them, just as they're protective of him. So you going back to your point before, Ash, about masking, I was actually just thinking, he probably wouldn't want to stress his mum out. Mum's had a stressful experience. Dad abandoned them, she's remarried, and he loves his mum. He's certainly very close to his mum. Actually, on the day of the murders, the morning before he went on the trails that day, he had been visiting his mum and his stepdad. I think his sister had been there too. So yeah, you kind of think about the impact there of is he trying to hide this? Is he trying to contain this? So, and I mean, for the people who are listening now, not hide anything deviant, because I think that's what they'll sort of try and get to, the people who think he's guilty, but more that he might have, been trying to hide some of the difficulties. That might be why we don't have reports that I'm aware of bullying. I mean, we don't know. There could have been anyway, because the testimony is quite limited, as you can see.
But that would,
I guess, just to really reiterate here, we have a person who's highly conscientious. He seems to care so much about doing the right thing, not making mistakes, being there to protect, his wife financially. I just feel like this is a man who cares a lot, and has done from a very young age. And I work across the lifespan, so I do work quite a lot with children, probably because I'm a big kid myself. And when you see a child of a very young age showing significant anxiety, that generally does tend to be a sign of more of a temperament-based kind of like a predisposition to be more sensitive. So I take myself as a child, I was like this. I take my son as a child, like he absolutely worries about being in trouble. So funny story about my older son. He was in kindy in year one. Actually, it was year one. He'd come home and he'd say, I got in trouble 10 times today. And I started to be really worried. I was like, what's he doing at school? Like, he's a bit cheeky. He has ADHD, like cheeky as in like hyperactive cheeky, like not mean or naughty. And I'm thinking, oh gosh, is he doing silly things in class? So I went to his teacher and I was like, oh, he tells me that he gets in trouble every day. Like, what's kind of going on? And she's like, he doesn't get in trouble. What do you mean? Like, he's such a good kid. And I was like, well, what's he referring to? And it turned out that he thought that when she said, put the pencil down, or, oh no, just look at this, or put that book away. Like, if he was even doing the slightest little thing that needed a bit of correction, that he was getting in trouble. So this is what happens when we have this really heightened sensitivity and this heightened conscientiousness, is that even things that other people wouldn't even think twice about, we get stuck on. Another example, like mother, like child, we were at a resort earlier this year and we were in the pool beyond the closing time, and a lady came out and she said, you're in the pool late and my baby's trying to sleep. And I got so upset and worked up because I was so worried that I was in trouble. And so, yeah, like even to this day at the older age of 42, I still worry about getting in trouble. I worry that people don't like me. I worry that I will lose my job, even though there's no indication of that. Even yesterday, Diana, you sent me a message and you said, here's some feedback on your toolmark video. And before I opened it, I felt my heart go, oh no, what are they going to be saying? And it was a positive comment. And I should have known it would be positive, because Diana's not going to send me really mean stuff like that, like, and go, here, look at the feedback. But I straight away was like, oh no, what have I done wrong?
Yes. That's RSD for you.
So the amount of times that I've tied myself in knots thinking that that's it, I'm going to lose my psych license, and gone to colleagues and they've been like, you're not breaking any rules. How you haven't had a relationship with a client. I'm like, no, of course not. But for me, it's like, oh, but I didn't send the letter to the doctor on the exact right day, or, oh, I said the wrong word, or I didn't return a call within, 24 hours. And I'm like, that's it. It's doom and gloom. And my dad was very much like this too. And I've often said, I think one of the things that in a way have maybe pulled me into this case is that Rick does really remind me of my dad. My dad was the person, he wouldn't necessarily curl up in a ball and cry, but he would always be like, I can't do this. He was a structural engineer, and he used to say to me, never study engineering. It's the worst thing ever. He would just get himself tied up in knots. And my mum would be probably like Kathy, having to say, you're okay, you got this. So, yeah. Any other thoughts, Sana, before we keep going?
I couldn't tell if it was you talking now live or if it was talking to your colleagues. Let's see. No other thoughts right now. I missed a big chunk of that, unfortunately, so I'll have to go back later. But
I mean, a lot of it was just still them kind of having very similar observations to us, Diana, around, the sensitive neurotype, just really kind of referring to those aspects of Rick, of the fact that, he is much more sensitive than the average person. And we were just talking about other potential contributing factors. We might continue on, because this is probably going to take 4 hours otherwise. So I'll play a little bit more of the recording.
Sounds good.
Explain his school refusal, right? Because
exactly.
there is always one part, but it could also be driven by bullying. I guess one point I wanted to raise is, and again, like, I'm not diagnosing, I only know very limited, but as a hypothesis, right? When you have a child who presents as that anxious and with all those kind of patterns of thinking around, harm to himself or his family and things like that, I guess there's also this consideration of what we know regarding early kind of psychosis, that being ultra high risk. And we know that there are studies out there that kind of links, highly sensitivity to neurodivergence, whether be it ASD or ADHD, to I guess that kind of a presentation. So I'm just putting it out there that maybe that's something to consider as well.
Yeah, for sure.
If we're on the topic of a hypothetical diagnosis again, right? Like, this is based on just what we know so far. Then I'll be thinking the differential also is thinking about obsessive compulsive disorder. So Psychosis. Yeah, I think Mel is probably more.
I just have to say this. I feel so vindicated because I said OCD many, many months ago. And I know I'm not supposed to talk much about when I get trolled, but that was one of the things that I got trolled about from a few people who are quite known in this community as saying, that I was ridiculous, essentially, trying to put neurodivergence and OCD onto Rick and think I had other suggestions that were better than Dr. Westcott. But I was really glad to hear Ash, who, like I said, is an exceptional therapist, next level exceptional, kind of say, another diagnosis we would consider would be OCD, because that's exactly what I hear when I see this presentation. That is the group of people I work mostly with, I specialize in, and Rick, absolutely. I am so curious. I would love to do the Y box on him, which is one of the screeners for OCD. So anyway, I just needed to point that out, everybody.
Well versed in that than I am. I have some experience with that, and so I wouldn't rule that out. I would, if this is an assessment I'm doing, I will still check for that. But I will also be considering obsessive compulsive disorder, which is also quite common in that sort of highly anxious, and, possibly neurodivergent kind of and highly sensitive child. Yeah.
Yeah. And certainly that's something that was on my mind as well, looking at this. Just gonna give you just a couple more detailed little bits and pieces that I sort of have, because it's quite hard to get it all from the testimony, because it kind of goes all over the place and there's all these legal aspects as well that show up. And also what we get from the witness is dependent on what questions are asked by the lawyers, and also what questions are allowed to be asked by the lawyers. And just a little side point on this for Ash and Mel, who I can't help myself. I have to jump in every few minutes. This is why it's going to take 2 days for you guys to listen to this. But 2 points. One, I want to ask you, Diana, and because you haven't read the testimony, so it's probably a little bit tricky. Maybe for next time, I want you to look at some of the questions that the defense ask Westcott, and maybe we'll have a chat about that. I don't want to be critical, but I do feel like the questions asked by the defense towards Westcott didn't elicit enough information that could have been supportive of Rick. And I'm concerned that some of Dr. Westcott's responses to questions were not detailed enough to give the jury a very good understanding as well, particularly of psychosis. So, again, always good to play, what do they call it, Monday morning quarterback or whatever. Like, of course, in hindsight, you can say, well, they should have thought about this or should have thought about that. Like when we're supervising or observing other people, it's so much easier to come up with things they could have or should have done. I mean, I do that all the time when I watch back my own videos, but I think that this testimony was not as strong as it should have been. And this is such a core, integral part of the defense for Rick Allen. So that was kind of upsetting, but maybe we'll kind of talk about that in a subsequent video. But just also to your point, Diana, about some of the other people who have done psychological analysis online about Rick Allen. I'm with you. I'm actually quite disappointed to see, and I want to be collegial here. I don't want to be critiquing other clinicians directly, but I do think that we have to be so careful about how we're speaking about particular mental health issues online and labeling people in a way that is super unfair. Like, I just think there's inaccuracies in some of the other commentary I've heard on Rick Allen, and what psychosis is and how it would show up and all of that. But yeah, we'll get to that. It would definitely be a difficult watch to kind of dissect other people's thoughts about it, because when I've listened to them, I've found myself really quite cranky.
I was yelling at the screen. But the defense should have had a psych consultant, especially since he did experience the psychoticism. That would have been a good idea.
Yeah, I really think that the defense, maybe didn't fully grasp the psychology here. And I mean, I guess how should they? That's not their expertise. And I think this is what the expert witness is supposed to do for them. But because we've never seen the 127-page report, there could be, you know, lots of wonderful detail in there that we're just not having, partly because of the questions asked of her, and also partly because of the legal aspects where things get suppressed. I mean, it's hearsay. You can't hear about family history. You can't hear this. You can't hear that. And it's like, well, then that's a really disjointed view of a person, because when we're doing a psychological assessment of someone and making sense of someone, family history is important, you know, so are reports of other people. But if we're going to call all of this hearsay, then you're going to get such a limited view of someone, and that's not really going to help a jury make sense of a person. And I don't think that the jury had a very good understanding of Rick Allen from what I read in the transcripts and what I heard during the trial.
I mean, I would object to it being hearsay, because they could always say Rick reported that his mom was blah, 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 blah.
I think the issue here is I don't think Westcott actually spent a large amount of time with Rick. I could be wrong, but I think there was many hours, but a lot of it was the neuropsych testing, and that was done by her assistant. And also we're looking at him in August 2023. He was still experiencing significant psychotic symptoms in June of that year. So I don't know that we're going to get the best picture from Rick alone in this case. I mean, even by the time it got to trial, which was another 18 months later or a year later, I mean, he was still like, he was reading the Bible, like while the jury were, you know, sitting down and getting ready for the day, which of course, there's nothing wrong with reading the Bible, but that's an unusual thing to be doing when you're sitting in court, you know, on trial for a double murder. And it makes him look like he doesn't, you know, that he's not interested in the trial or whatever. You know, there are mannerisms that can make him look suspicious. Where he's not suspicious, he's still, I think he's just still largely quite unwell from, you know, from what we've seen of him. So anyway, okay, let's keep going. Who obviously didn't follow the trial. The judge in this trial was seemed very heavily influenced by the prosecution and much more a tendency to side with what the prosecution thought was or wasn't admissible. So the defense was somewhat handicapped with a lot of this stuff. But I'm just going to tell you a few more things. So one of the things was he got very sort of stuck on feeling guilty on finances. So he really worried that he wouldn't be able to provide for his family. So he had even purchased like the stock ticker on his phone, and he was looking at the stock market. Now they lived in a pretty nice house in the Delphi area. You know, he had a supervisor management job. His wife worked at a veterinary clinic in administrative kind of duties, and his daughter had gone to university and, you know, had graduated. So, you know, they were doing pretty well. You know, he was driving, this is 2017 when the crime occurred, he was driving a 2016 car. You know, like it's, you know, clearly they're not a family that were on, you know, the brink of any financial collapse, but yet he would get so worried about it and stuck on it. So this fear of not being able to provide for his family, this fear of not being able to do well enough at work, this fear of what other people thought of him. Those are some of the themes. Another thing that I wanted to raise about him was that he did do some college, and before that he had these sorts of retail roles as well, just to give you a little bit of an idea of, I guess, some of his educational background. Just on that, because I will go to the neuropsychological findings as well in a minute, what would you predict in terms of, and I mean, obviously this is a big question, what would you assume in terms of his overall, like, cognitive functioning, like his IQ? Would you guess kind of average, above average, below average? Diana, any thoughts? Like, I don't know, it is a big question. Obviously, we're not doing a cognitive assessment, but based on his employment history, would you suggest that he would be about average or below or above?
I would say he's average.
That's what I would think, right? There's no indicator here that he'd be below average. You know, whether he's above average, it's hard to tell. You can't really probably tell that particularly well, but he wouldn't be below average if you're kind of managing to consistently be promoted and you've studied a bit at college. You know, it sounds like, you know, the family has, you know, done quite well in their life. The suggestion there would be that not because somebody with a lower IQ isn't capable of doing things, but, you know, that seems in line with sort of the average, right?
Yes, yeah. Agreed.
And the reason I'm asking this question is not because we'd usually want to worry about people's IQs here, but it's because we're in light of some of the neuropsychological findings that Westcott reports.
So I want to say, but like
I know it is.
I would put it in the average ballpark. Like I think that he is not either extreme. Like he there's no obvious like highly gifted, but there also isn't an obvious intellectual disability.
Yeah.
I would say average, but I'm not sure if there is a low average, high average, like that. I have to have more information.
Yeah. But I guess that's the point I was getting at. Like so we're not looking at, significant standard deviations below the norm, but we're also, not necessarily looking at, significantly above average. I agree. It's probably in that sort of bulk of the bell curve. Yeah.
Yeah, and I think, look, if you look at his functioning based on what you said, Amy, look that he has working in retail, he's always had supervisory or managerial roles. So he's living a pretty decent life. So you definitely can't doubt his intellectual capability. You don't definitely see any kind of cognitive deficit. I don't hear that in the life he's led thus far. And we know that with the supervisory and managerial roles, you need to have certain kind of problem solving skills and able to manage people and those kind of things. And I think if he was below average, then I think those things he would struggle with. And the fact that he's been on only 3 jobs, that means he's been able to sustain employment. So
exactly. So what we might do is we're going to pause there in terms of the testimony, and we're going to watch a tiny bit of the interrogation video just so you can get a little bit of a baseline of what he looks like, what he sounds like. Initially in this interrogation, it's not actually an interrogation, it's an interview where he's been brought back in after 5 years after the crime. It's still not solved. He was, as I've mentioned to you both previous to us starting recording, was that he went in and did an interview because he was on the trails that day. He volunteered information, but then was never followed up because they were chasing other leads. And then 5 years later, there's this renewed interest in the investigation, and because obviously this is 2 murdered children essentially, and they haven't solved it in a town of 3,000 people. So also bear that in mind. He works at the only pharmacy in the town, the big CVS pharmacy, in a town of 3,000 people. So a lot of people will have seen him. And this is relevant because, as I mentioned to you guys as well before we started, that there is the Bridge Guy video. Have you guys seen the Bridge Guy video actually? I think I may have shown you at some point.
No,
I haven't.
Okay. Well, look, I mean, that's just something to you guys can have a look at that in your free time maybe. But the video is a grainy image of a man following the girls on the bridge. It could be any, man. It looks like a middle-aged man just because it's got a little bit of a paunch of a stomach, but it's really hard to tell. It's incredibly pixelated. Subsequent to his arrest, people said, well, clearly that he's Bridge Guy, but I guess I bring up this point that it's a small town, 3,000 people. He works at the only pharmacy in town. If it was that obvious, that picture and video was on their screens for 5 years and nobody, felt the need to dob him in. So just something to be mindful of. But let's watch the interrogation or the interview. We'll watch the interview where he's been brought back in. This is early in the interview. He thinks he's just giving more details again about what happened that day. He doesn't feel under suspicion. So we'll watch a tiny clip of that, and then we'll forward to a little bit later in that interview where they start coming down a little bit harder on him. And I'll get you to give a little bit of an opinion on that. So we're going to just watch Rick Allen coming in for this interview where he thinks he's just coming to provide his witness statement again 5 years later, and then we'll forward up to when they start putting a bit more pressure on him. So just a few minutes, guys, because I mean, most people who are watching this video will have watched probably these interrogation tapes in full. And so I don't want to waste the whole time watching, the hour and 28 minutes, but it'll be just giving you guys a bit of a snapshot of his baseline behavior.
Okay, great. See you later, Richard.
Just a little joke. So this man here, this is Tony Liggett. He's the sheriff. This is Steve Mullen, who is one of the law enforcement officers. A lot of people would probably want your psychological assessment of these two. These to people have a lot of hate online. I'm not going to say anything directly negative, but yeah, I guess, you know, there's some questionable things that come about as a result of this law enforcement team. Anyway. Yeah. I can never help myself but have some snark here. My snark directed towards certain people in this investigation. I can't hide it. So you'll get a few little funny comments here and there about some of the ISP and Delphi police. Yeah, Diana, it's because I'm a loudmouth. So I sound loud when I'm in that video, and I sound loud on here too because I'm just a loud person.
No, it's because your little avatar thing usually, like, it'll move when you're talking, but yours is just staying still.
Oh, okay. Also, because I have edited this video, so there may be times where, because it's edited, it may not flash as well. The reason I edited was because when I listened to it back, the ums were just killing me. The I'm like, no, I got to get rid of some of those. So there are bits where I've chopped out, particularly for me and for Ash. With both of us were terrible with the umming and ahhing. But anyway, yeah. All right. So let's go back to the video. These guys, you know, they accidentally recorded over the first 2 weeks of witness interviews, and, you know, they accidentally lose a lot of things. But, you know, there comes a time when, you know, there's multiple accidents in a row and you go, well, either they're the most incompetent police department in the entire world, or there's something more fishy going on. But anyway, okay, side point, let's go.
Thank you. I don't know if I gave you one of my cards. There it is. I had to get it. I think you did. I probably set it down. Oh, sorry, there you are. So the reason we wanted to talk to you is about the accountability case. And appreciate your time in doing that. And as a formality, before we talk to anybody about these things, I want to make sure you understand you're not under arrest or anything like that, okay? And the door here is open. You can leave at any time you want. I'd be glad to give you a ride back or whatever. So, but we need to make sure that we go cover a formality here, and I'm going to get to the page here where it's this is a Miranda warning. So.
Okay, so you can just see that little bit of a sense of humor there at the beginning, and he's, you know, he looks a bit tense, but, you know, that's the early stage. I'm just going to forward for a little bit. I'm not picking specific sections out. I'm just like going to just randomly pick little points so you just get some baseline.
I lived in Mexico most of my life.
Mexico, like in
Indiana,
like in Miami.
Yeah, you always get that. Yeah, Mexico, Puerto Denver. Yeah.
Okay, it was Mexico. Yeah, okay.
But it was Peru was where I was in the National Guard at. Sorry.
All right. Go to church anywhere?
No.
Have you ever?
On occasion, nothing.
Okay. Where did you usually go to? Any place around here?
I don't even know. No, not around here.
Okay. All right. Parents go to church, or did you take you to church?
No, my grandparents went to church. My parents didn't.
Oh, I see. Okay. Any criminal history? Have you been arrested for anything? Okay. Any medical problems, heart trouble, high blood pressure, psychological disorders?
Oh, yeah. Everything.
Okay.
I've had a heart attack. I've got a couple stents.
Okay.
And
how long ago was your heart attack?
2010.
Okay, you were 40.
It's actually a pretty opportune time to show you there, because it talked about the health history, but also another thing that he mentioned there was he doesn't go to church, seems quite disinterested, and this will become important when we look at the second half of, I guess, what we're going to look at, which is when he's in custody, he becomes hyper-religious. Okay, just going to go ahead a little bit more to now when he's talking about being on the trails.
Up there, and correct me if I say anything.
The bridge.
Over here, in that building, I'm sorry. So if you're parked there, how did you get on the trail? Where did you walk?
At one point, you either walk down the road, but then at one point they had a trail there. Not a trail, I wouldn't even call it a trail. They had a gravel path that led to the new thing that they were doing. I call it the trailhead. When they started doing all that, there was a trail that would, I think it ran along the road, if I remember right, and then it just cut over to where the trailhead was at. You couldn't really park at, I just remember where that path was at. You'd think you could park there, but it's no parking. So you had to walk. You either parked over here and just, it was actually closer if you went over here and you could just walk to the bridge that way. And then if you went this way, it was a little.
So guys, this is, I mean, like this is just still snapshots, but they're quite consistent with how he presents throughout this interview. Anything you're noticing so far? Sorry, I'm going to go to you first, Diana. Anything you notice about his behavior or like his presentation, I suppose, in the interview?
Oh, he's calm. He's not worried. He's feeding into what they're putting out, like, you know, trying to be cool with him. But what made me mad was they really harped on the church stuff, but they just breezed right through the psych and the medical stuff.
Mm-hmm. Yeah. I don't know, like where they got their questions from, honestly. You know, I don't know why they're so interested in the church stuff at this point. It's a bit odd, isn't it? One of the things, and I'm sure I mentioned it in the recording too, but that I noticed when I first watched this interrogation, I mean, this was a real turning point for me in my interest in the Delphi case. When I saw this is when I was like, I don't think this man is guilty. I think that this man has a lot of other aspects to his personality that could really explain how he's got into this position, I suppose, of the confessions and all of that. Because what I see here, going back to our discussion earlier about neurotypes, is he's highly conscientious, he's highly verbose. Like he really goes like around and around. And I know that's partly because they're pushing him, like, where did you park? Where did you enter the trail? But he gives a lot of detail. And it's repetitive at times. And it's like, it just reminds me of me. Like I always say this on my videos, you know, you can see I'm verbose. I feel like I need to give more and more detail and talk my way through things. And it just reminded me so much. I was like, this would be me. If the police brought me in for an interview, they'd be like, oh my God, we can't get rid of this woman. Like, she's just going to keep like telling us more detail that we don't need to know. Yep. That's enough. You know, that's me when I go to like my medical appointments. I want to tell them the whole history. And that's how I feel with him. Like he's got this sort of, he blurts out a lot of information, but not suspicious at all. He is relaxed, but not relaxed in a weird, cool, calm, collected way, but just in a helpful way. He thinks he's helping with this investigation, and he's trying to remember in detail everything that happened that day and help them. And he walks into their little traps of trying to trap him at where he parked and what he was wearing that day. Because if he's this mastermind criminal that has evaded police for 5 years because he left no DNA or anything at the scene, then surely he'd know when he's being interviewed not to say he was wearing clothes that could be what Bridge Guy was wearing. Like, come on, why would he say that? Why would he say, yes, he could have parked at the CPS building? And I know this is contentious, but there is a point where he agrees that could have been where he parked in this video. So why would he do that if he was trying to distance himself from the crime? So the people that then say, you know, he changes the time to distance himself from the crime. No, the change of time, I think, is, like I've said before, the telescoping effect. We're not very good at remembering times where we arrived and left places, particularly not 5 years on. But yeah, there is no sign of deception here to me. So
Same.
I get so passionate about this, I know, but it's like, yeah. It's just so obvious and clear as day to me. There is nothing unusual about how he's interacting, other than that he's highly conscientious and that he goes down his rabbit holes. I really think Rick and I, if we chatted, would probably be talking for a long time, because we'd both be going on 20 different rabbit holes. I think I see a lot of parallels, and that's where I maybe have some formulation from, which I know could be biased because it's my own personal views. I'm over-explaining right now, see?
Hey, I love details. The more details, the better, in my opinion.
Yeah, exactly. Well, I found, like, when I listened to this interview, and I've listened to it a lot of times, that was what the basis for my timeline videos were, and my basis for, like, understanding what he's actually saying, where he sat, what he did. My notes that I've taken from this interview are 20 million times better than what Doolan has on his little interview sheet that finally came out yesterday, which is so ridiculous and basic. And yeah, so if Rick's able to explain in this much detail in 2022, that interview back in 2017 would have been more than a few lines. This is ridiculous.
Definitely.
So, all right, let's keep going.
I mean, I'm not sure if this is kind of aligned with your question, but I'm just kind of picking up that, well, he's probably not one to be very good with his memory, but, you know, it kind of feels like he's not, he hasn't like pre-planned like what he's saying, like he's kind of just going like riffing off and just trying to give the information as he's being asked, which is kind of where then it's, you know, like he's kind of, oh, this, oh, that, oh, it could be this, could be that, which is what happens when, you know, when we don't prepare for something, we, that could be
like non-defensive memory, I think I read somewhere or something. Yeah,
okay.
Do you, actually, the first instincts, and then I'll offer some of my things.
Yeah, look, I think to me he comes across that he genuinely wants to help and give a accurate, I guess, recount of where he was and what he wants to do. So he's not come with any premeditated prep or anything. He is actually trying to recollect to the best of his memory of what's happened. To me, he's coming across as, you know, genuine.
Yeah, for sure. Because we're now like 35 minutes in, and if you watch the whole thing, these two here, they just go round and round. Where did you park? Where did you park? Because they're really trying to, if you know a bit more about the case, they're trying to pin him to this particular car parking area and going on a particular road. So they really do just keep hammering the same thing over and over again and bumbling around. So my sense is there's a lot of patience. He doesn't seem put off or annoyed. So genuine, like willing to help, eager to help. And I hear verbosity, which you're pot calling the kettle black here. So that's me, right? Like he's giving so much, he actually gives a lot of detail. It's like, so there was a trail here and then there was a gravel here, but not a gravel. And I used to call it that. And like, he just kind of goes off in a zillion tangents. So, I mean, I guess what Ash said was like, you know, it's kind of like, he's really trying to think and it's, you know, he hasn't pre-prepared it, but also like, I still feel like it's particularly verbose, but I don't know if that's just me. I mean, because this is also now, you know, 5.5 years after he went on that little walk on that trail that day. And yet, you know, he's actually giving quite a bit of detail because I think he's trying to, like he's really, and not in a suspicious way. It's because he's super conscientious.
Yeah, it sounds like he's actually trying to, like, because I think the context is, this is the time where he perhaps believes that he's trying to help them, like he's being to give to support in finding evidence, right? So yeah, I guess like it shows like he is very trusting of the officers. So even when they ask him like questions at the start, you know, he was just kind of like, you know, what kind of conditions do you have? And he was like everything, and so it's kind of, I mean, like, you know, that perhaps like the officers did kind of try to put him like, you know, let his guard down, and but I do think that this is someone who just kind of is like genuine and you know, just trusting in that sense, like to an extent, like he's like, okay, you know, people of authority, they want my help, like I'll just try my best kind of thing. That's just a
because he hasn't got a lawyer there, and look, I mean, sure, this is still early days, but even when we will look at the second interrogation, which is 2 weeks later, when they've already searched his house, you know, and they've got his car, and you know, they're really hammering him, saying that there's his bullet at the scene and stuff. He still doesn't ask for a lawyer. So he has not had a lawyer throughout this entire process. So yeah, I mean, I just see he comes across personable, doesn't he?
He does, and I think his, you know, the verbose part that you see, I actually think that he's thinking out loud.
Yes.
You know what I mean? That's what I'm picking up with the detail, because it's like, you know, maybe this again a hypothesis, or maybe just, I think when you try and recollect, people are sometimes visually recollecting what's happened, and that's what he is then narrating to the officers there. A couple of things I picked up, you know, and I know that we are skipping through the video, but just in one place I picked up that they weren't actually letting him complete what he was saying, and they would jump in to ask the next question, or I don't know, I didn't quite catch, but it's like he's not completed what he said, and they've jumped in either with another question or broken.
That's because they're trying. So the background of this is that these two now believe that he is the bridge guy. They're already, because they found this lost chip and they think that they've matched his car. And so they're trying basically to get him to tell them the narrative that they already believe. So yeah, you're right. I mean, that's exactly what they're doing. They're trying to fix him to the. So Diana, question, not as a psychologist, maybe just more opinion here, and everyone in the chat too. Do you believe that Liggett and Mullen think that Rick is guilty and so they're trying to get him to show that he is, or do you believe that they don't think that he's guilty? They know that they're setting him up and they're manipulating him to give information to try and make him look bad. So in the chat, guys, okay, here we go. In the chat, put a 1 if you think that they are truly believing that Rick is guilty and just trying to get the evidence from him, and a 2 if you think they are setting him up. Shibby, I'm with you. I'm in category 2. Yeah. Okay. Yeah, that's what I thought.
Oh, oops.
Oh, goodness. We got some balloons for that answer. Oh, hey, big fish. Okay, 1. Yep. So you think that they truly do believe it's him and they're just trying to make sure that they get the evidence. Fair enough. It's hard to tell. But yeah, I've lent probably more towards number 2. Come on, guys. Don't sit on the fence. Everyone in the chat, there's 18 people watching. I want 18 numbers. Anyway, okay, let's keep going. Story that works for them basically getting the warrant and arresting him. But what something you mentioned as well, Mel, around like, he's searching his visual memory and stuff. He does give a lot of visual details, actually. You notice like the gravel and the trailhead, and then there's a road that goes around. It's descriptive around that. So yeah, that makes sense. So a lot of conscientiousness is what I'm seeing here too. And I don't think I'm going to be able to find it in here because I didn't timestamp. I probably should have looked at this. But there's a few points, and he says this repeatedly a little bit later when it starts to sort of turn a bit. He says, hey, like, I don't want to be anybody's fall guy. Not that I'm downing your integrity or anything. But, I know you really want to solve this case, but, I just don't want it pinned on me. So he starts to like suspect that that's what they're doing. But even then he's polite. He's saying, I don't want to doubt your integrity. I mean, like, to me, that again, a lot of people, and I don't know about you guys, I mean, I'm more like him, so I'd probably do what he does. I'm a people pleaser as well, so I'd be saying that too. But a lot of people would start going, what are you accusing me of? How dare you do that? But he still doesn't really seem to get angry.
Yeah, I agree. And I think that that was kind of perhaps, I guess the English word doesn't kind of really give it the weight of what I'm trying to sort of portray. But, like sort of that sense that when someone is more trusting and like there's an innocence, right?
Yes.
Or in a more extreme way, perhaps naivety as well. And not saying that that's a good or bad thing, but it's quite the opposite end of the spectrum of someone who is then coming across as like defensive and trying to protect themselves. Like that there is this kind of like wanting to just kind of be authentic, be themselves, and just hoping that with the truth and honesty that like that people would. Yeah, like that things would go.
Exactly.
Yeah.
And he does say at some point, like, I don't have anything to worry about because I wasn't that. But, I think that, and that's probably why he doesn't get the lawyer. But I think what we've got to think about here too is that, if he is bridge guy, then 5 years have passed since the crime and he's got away with it. And then suddenly he's hauled into the police station and they're asking him all these questions again. I mean, to be this personable and calm, that's kind of unusual. Either you'd expect cool, calm, collected, calculated, I've got an answer for everything, or you'd expect agitated. At least that's my sort of sense.
Yes.
Yeah, and if he's coming across as cool, calm, and collected, if he is guilty of committing those crimes, then there's something quite wrong with the pathological picture. Then, right? You are looking at somebody who's able to, I guess, portray himself such polar opposites.
Yeah. Which again, then later on when we see him decompensate in custody and confess 61 times, it's like either you're cool, calm, and collected and calculated because there's psychopathy there, or you decompensate in jail. Like a psychopathic person doesn't decompensate in jail after they've spent 5.5 years living, knowing that they've killed two teenage girls, being calm and collected. So anyway, we'll get to that a little bit later, because I guess that's kind of looking more at the forensic aspect. Also, interestingly, Rick's got a daughter himself, and these are girls maybe probably about 4 or 5 years younger than his daughter at the time of the crime. So I kind of just see the dad in him going, because, I always say when I first heard about this crime, all I thought was, gosh, I wish I was on the trails and I could have helped those girls. I would have intervened, and I can just imagine if you really were on the trails that day, that's what you'd be thinking, like, God, what if that was my daughter? Like, this is awful. And this is a small town. It's been something that they've heard about, for the past 5.5 years, an unsolved, double homicide, brutal homicide of 2 teenage girls in a small town, So I think, he would definitely be affected by that as a dad too.
Yeah, which kind of speaks to that high empathy, highly sensitive personality type again, right? And I think also, like, this is kind of what I tend to observe as a pattern, that when people are like highly empathic, if they don't know that that's a difference that they have from the norm, they would tend to believe that everyone else is also like them. So I think that's what I'm noticing, that he's kind of, almost kind of like thinking that the police officers are kind of, also trying to help, and that's kind of why he's responding that way.
Yeah. Absolutely. And because I think of myself, like, that's what I assume. I think coming into this case, when people were talking about police tampering and conspiracy and things like that, I was like, no, I don't believe that. I don't think that would be what happened. So, we all know that there can be bent police officers and things, but you don't assume that. And look at these two; they look like this sort of unassuming, particularly the older guy. They look like he could be like the church pastor or something. And they even also play on this in the way that they ask questions. If you watch the full video and if you watch the next one with another equally problematic law enforcement officer, they say, we're trying to help you, and so they definitely play on that too. All right, we're going to skip ahead a little bit further, because I don't want to labor it too much, but let's look at now a little bit later on in the interview where he starts to feel like he is being suspected. So we're going to go quite a long way away, probably right down to the last sort of half an hour to 45 minutes, where things are getting more heated.
Driven out there in your car, and you think you've driven out there in your car. We have a picture of your car that shows it was going out to the trails that day, okay? And
we have a picture of a pixelated, blurred, big black thing. That's your car? Sorry, couldn't help but say that.
Now, one of the important things for us is to help understand exactly where you were at that day, what was going on. You've already told us that you were out there. That's really, really important.
Sure.
Okay.
Yes.
So with that, what I wanted to do is try to help you work through this whole thing. I'm going to be completely honest with you. We've been able to talk to your wife. Sure. Talk to your daughter already. Well, this can all happen. We had time to do all of that.
Sure.
And we've heard that you had some issues, even at one point put a gun in your mouth, that you were going to do something.
Oh, just to your point, Diana, in the chat where you were saying people pleasers can misremember. I kind of put it this way to my clients, like when you have a highly sensitive nervous system, when you have an aspect of neurodivergence, you spend your whole life being gaslit. So I take this for myself, like, here we go, I'm on camera again. So I have ADHD, I have a lot of overexcitabilities, and I know this always sounds like bragging, and I'm not trying to brag, but I am a systems thinker. So I dig deep into things. I find connections between things that a lot of other people don't find on the surface. And so I often get told by people, no, you're wrong. Or no, I don't see it that way. Or you're too emotional. And that has led to me being somebody who is now in my 40s who still has imposter syndrome. I still think I must be wrong. And, you know, the people who've been watching my channel and following me know that when I got trolled, the reason I think I took it so personally was because I start to assume I must be wrong. I go, well, if everybody's saying I'm wrong, then I must be the one in the wrong here, because there's a whole group of people telling me that I'm stupid and I'm crazy and they're kicking me out of their groups. And I actually fall for it on some level. There's a part of me that the younger part of me that is so used to people saying you're wrong or you're too much that straight away starts to recoil. And then there's an adult part of me that says, no, actually, you're not wrong, Amy. You know, you actually do know what you're talking about. So, yeah, I think if we think about it, if you come into the world with a nervous system that is more sensitive than the average person, it's the equivalent of you sort of saying, like, I think of this, I'm trying to explain it the way I would to my clients. So think of a dog. A dog has a heightened sensitivity to smell. Imagine if dogs could speak and the dog says, I can smell the fish in the fridge. And you go, no, you can't. I can't smell it. I can't smell the fish in the fridge because I can't smell the fish in the fridge, but they can. So that's what they call the double empathy problem. And it's something that they talk about a lot in autism, but it's actually true, I think, for, you know, a variety of us with all the different types of neurodivergence. It's the idea that I don't have the same worldview or sensitivities, experience as you, but I'm trying to say that you should have the same view as me. So if I feel strongly about this and you don't, then you're wrong. I don't know if I'm explaining particularly well here, but yeah, the idea being that sensitive people feel and pick up more than people who have a less sensitive nervous system. And as such, they're saying, I can see all these layers, and the other person saying, no, I can only see this. And so that's the gaslighting, ultimately, that you would have your entire life feeling like you're wrong, you're different. And I think Rick really is someone who fits in that category. I hope that makes sense. Yeah. Okay.
Totally, it does.
Something to yourself, maybe 3 years or so. And, you know, look, there's a lot here that we need to get clarified, okay? As you well know, we have pictures of an individual who is on the bridge. And to some great degree, you describe that individual as wearing blue jeans, a jacket that's of the same color as that. He described a hat. It's hard to see the shoes, but they're kind of brown, okay? And this is a picture that was taken with the phone of one of the girls. Okay.
Mullen's tone here, oh my gosh, he's talking literally like he's a school teacher. He's pretending he's like being so kind about how he's saying, like I said before, the church pastor. That's kind of the attitude of him. He's like, so there's a guy wearing a blue jacket. And because he's talking like that, it's so manipulative. It's like, ugh. Is that part of the read technique? I think that is, right? Like that's part of what they do in those sorts of interrogations.
I'm not sure, but
Yeah.
it definitely sounds like he's gaslighting them into it.
Yeah, so I think I always thought the read technique was, it's their way of them manipulating somebody to kind of give them the answers that they want. And I think it can involve like things like, trying to say, we care about you or we're trying to help you.
Mm-hmm.
Yeah.
I understand that. And the question needs to be, is that you?
If it was taken with the girl's phone, that is absolutely, it's not me, but I never have met these girls before, so even if I thought it looked like me, if it was taken with the girl's phone, there's no way it could be. I've never met them. I've never seen them.
All right, so that's
and let's just stop there.
And the people who believe Rick's guilty make this big deal about the it's not me if it was taken by the girl's phone comment. Rick he just doesn't talk in simple ways, like you hear him when he talks sometimes, like I just feel like he's a bit wordy again. And so that's maybe he could have just said, no, of course it's not me. But again, he overthinks what he's saying, and a little bit like I said, like with me, if you heard me speak, if you were my client and you heard me speak, I am so much clearer. But when I'm on here, I'm overthinking what I'm saying to try and make sure that it makes sense to you guys. And so I start tripping myself up. And that is exactly what I'm hearing in Rick here. I don't think he's saying, oh, it's not me if it was taken with their phone, to be suspicious. I mean, that's a weird thing to say if you were suspicious. It's just that, to me, it just sounds like someone who's starting to feel nervous and overthinking what they're saying.
As far as my psychological well-being,
Okay.
I've been dealing with that for years. It's not something new. It's not something because I went out and killed girls. Now I've got psychological problems. Have I had issues? Did I stick a gun? I know how a gun works, and I wasn't going to shoot myself that night. It was probably a cry for help that night. You've obviously talked to my wife, so it is what it is. But I know that you haven't talked to anybody that knows me, has been around me, my family, not my family, that thinks that I may have been involved in this. Would you believe it?
This image, this person right here, he's wearing like a Carhartt jacket, just like you just told us.
Okay.
He's wearing the same clothing that you just told us. We just need to know what happened. Why?
Sure. I said I was wearing blue jeans. Now, I think blue jeans is a pretty common thing that people wear. And I said I was probably wearing a black or a blue coat. It could have been a Carhartt, a zip-up with a hoodie in it. I've had black ones. I've had a blue one, or a blue one and a black one. I guess, you're taking what I told you I was wearing and saying that that's me in it.
So the other kind of,
And you're serious. You literally want me to, that is you want me to say that that's my car?
we looked at, it matches everything. That is your car.
Okay, well, I'm saying that picture, it's like, okay,
Yeah, no, that there's zero doubt.
Such a gaslighting moment, because he says, see, that picture is like, yeah, okay. I mean, that's exactly what we all think when we see that ridiculous blown up picture of a car that's pixelated and poorer quality than any other picture taken of a car from that camera that day. Rick is completely sound of mind here, and he sees this is ridiculous, but they're going, no, it is your car. Well, no, actually, Tony Liggett, it is not his car, because you have not identified it as his car. You have just made it up that it's his car. Nobody even knows where that picture came from. Anyway, sorry, I'm getting cranky again. I nearly burst out laughing then. If you see that picture, guys, up close, it is a ridiculous blur of black. And it is ridiculous that they're saying it's 100% his, because it actually, is very hard to identify a blurry tiny car.
Like it could be any car, right?
Anyway, look, that's beside the point. That goes into other evidence. But you can see, obviously, now he's getting more agitated. But anything you guys are noticing in particular?
I'm noticing him becoming quite anxious because they are pretty much leading him on. Like, they're not questioning him. They're asking him to confirm, right? They're not asking, is this you? They're saying, this is you. And I think that's what's making him quite anxious. Already, he's somebody who has anxiety, and asking him to respond like that is what I'm seeing come across. Yeah.
And at this point, they've spoken to his wife, they've spoken to his daughter, who, is probably, I think, in her early 20s, behind his back. They're holding him there now. We're now, I don't actually know how far are we now, an hour and 15 minutes. They've left the room, they've come back. You can see they've changed positions, and they're hammering it. They're saying, this is you, this is your car, this is this. And yeah, I mean, it's a lot, isn't it?
Yeah, and he's trying to logically tell them, look, people wear blue jeans. I mean, jeans is generally blue in color. And he's saying, look, my psychological problems have nothing to do with this. So he's trying to interject some logic, but he's getting shut down. So, yeah.
So it's quite painful to watch when you know the case as well as I do. I've watched this quite a lot of times. This video here was part of the reason that I really got stuck into trying to ascertain whether he was guilty or innocent. Because up until seeing this, the trial had already happened. He'd been found guilty. I'd been a bit on the fence, but I saw this and I just, and I think even people who still believe he's guilty see this and they don't see a lot of guilt in this. Yeah. Okay, so that's interview one. So it ends basically with them saying, we're going to basically search your house and do all this, and he leaves and says you're an asshole, and so he is angry, understandably, at the end of an hour and 30 minutes of being accused of this. So that gives you a little bit of a picture though of his baseline. Would you say that's kind of what you would expect from anyone? Do you think that's how you would act, how a partner would act, a friend would act, if you were in that position?
I don't know if I'm jumping ahead here a little bit, but I think, like there's so many variations of how people could react. But what I'll be thinking about is, how much is this person being having a defensive kind of part of them, showing up, and how much of that is them, I guess, being genuine or just having a reaction to what's happening in the moment, right? So, I guess looking at it from that frame, I'm not sensing a lot of defensiveness. And if anything, if the defensiveness is there, it's also more from a place of, no, that's not right. Like, that's not true. Like, it can't be. So it's still from that, it's not like I'm trying to hide something as opposed to like, that doesn't make sense to me. So that's what I'm getting. And the part that I don't want to kind of like jump ahead, because I feel like that there's probably more we can see to kind of get to that point. But this is kind of just taking a little bit of that, I guess, forensic lens. And from what I understand, like if someone has more of that sociopathy, psychopathy type of, I guess, personality or way of like being, then you kind of tend to see either, like either one extreme of like that more cool-headed and, like almost kind of like charming, but in that sort of like cool way, or that then there would be sort of also when they kind of like show emotions, it tends to be a bit that there's a feeling of it being put on, or there's an act.
Yes.
And again, like some people could be really, really good actors, right? But I think that's where, like we also have to kind of go beyond just kind of like what the person is saying or doing, as opposed to, how it makes people feel when they behave that way. So when I'm looking at that, like I'm not getting this sense of someone who's like pretending to be something. It really just sounds like someone who's quite simple and kind of going like, doesn't make sense to me. That's kind of what
exactly right. Yeah, it's like he's just a bit dumbfounded. There's a part in there, and like I said, I probably should have got the timestamps ahead of time. But there's a part where, they're holding up the picture of the bridge, and they're like, "So did you cross to this side or the side?" And he's like, "I don't even know what you're talking about anymore." Like he's just so confused because they're just hammering all these pictures at him. But okay, so to give you a bit of context now, this is about 2 weeks later. So in the meantime, what's happened after that first interview is they've executed a search warrant on his house that exact afternoon. After that video we just watched, he goes home and they basically search his house from top to bottom. I don't know if this is a rumor, but I think I've told you guys this before because my son got very sad about this. They dug up the garden and they dug up the grave of his cat, because who knows? So it's been pretty horrific. He sat in the car watching this happen, and he said to this officer here who's sitting with him, that the officer says, "Oh, we'll get someone to clean it up for you afterwards." And he says, "It doesn't matter, it's over." Now, this statement becomes a big deal. People say that that's conscious, that he's guilty. So he says, "It's over now. You've searched my house." The way he explains it is he means it's over as in, I care so much about what people think of me, and now all my neighbors and people around me think that, I'm a criminal because you've been searching my house and ransacking it with all these police and you've taken my car away. So, which to me makes sense. Does that sound valid to you guys? What do you think of that comment, Diana, that he makes to Holman apparently, that says it's over? It doesn't matter, it's over.
Exactly what I think he meant by it, which is, you guys are accusing me in front of everybody. You guys are convinced that I did this. You've already ruined my life.
Exactly. Mud sticks, right?
Mm-hmm.
I mean, that's what I even think for Rick. Like, even if, the appeal process is successful, if the conviction gets overturned, this is forever something that's going to be up to him. Like, if you look up the Delphi murders, you see Rick Allen, you see the mugshot. Like, it's so horrible. Like, it had already stuck by that point. This is the biggest crime this small town has had, or at least the most serious crime. And so, yeah, people will now assume like you don't go and dig up someone's garden and search their house for no reason. There's got to be something dodgy about him, even if he isn't the actual perpetrator. So yeah, I mean, that's what I see it as. He's just resigned. And this is a man who spent a lot of his life in despair with serious depression. And so that's a surrender response. So when we experience a threat, we can fight it and kind of attack it head on. We can try to overcompensate and deal with it. We can try to avoid it, or we can surrender. And I just feel like Rick here, he surrendered. Just like when he walks into the station for this second interview, he's already resigned. So he is like, just arrest me, you know? Like, I know you're going to anyway. What's the point? He even in his phone calls with Kathy as well, you hear a sense of surrender. Like, he'll sort of say, you know, if you need to move on, we'll talk about this obviously in the next video when we look at the phone calls. But yeah, he's the sort of person that's just like, I don't have any fight in me. I give up. So anyway, okay, let's keep going.
Yeah, like a helpless response.
Yeah, it's like resigned. So even he's come into the police station now to apparently get his car back. He's come in with his wife, but he's actually handed his jacket and I think his keys over to his wife because he's already resigned, thinking they're going to pin this on me. Because essentially they've now, you know, searched his place, seized things, seized his car. It's been nearly 2 weeks and he still hasn't got his car back. So he's there on the premise that he's getting his car back, but I think he's also somewhat resigned that there's more going on behind the scenes. So we'll just watch a few minutes at the beginning of this, and then we're going to skip ahead to see when his wife comes in.
Absolutely nothing. Okay. This is a property record and receipt. So this is going to read kind of funny, but you'll see. So we seal everything. So seal paperback containing 1 pair of dirty Thor good boot size 7.5 mins. And then on down. So we took the clothing that you had mentioned that you possibly could have been wearing the day you're on the bridge.
Okay.
And then we also took some knives.
Okay.
We took your car. And then we also took a weapon, a SIG 40, right?
Okay.
Right there. I used to be a Beretta guy. I was in the Marine Corps.
Yeah.
Shot the Berettas. And then when I first got on the state police, we had Berettas as well. And then we went to Glocks for a little bit.
Sure.
And then went to SIGs.
I was trying to think of what we even had. I think the Berettas were probably coming out before I got out. Because they used to have the old 45s.
So just here, they're talking about both of them have done some military service. And you notice that even though you can see he's stressed and uncomfortable, he's still engaging in conversation. Sorry, I just went straight to my interpretations. But yeah, did you guys notice that?
Yeah.
I didn't pick up on the stress. Yeah.
Yeah. So we're going to skip ahead now because it becomes, he gets quite hammered. So this person here, Jerry Holman, is another one of the crew that have been, I guess, very involved in making sure that Rick Allen goes to jail.
I don't even remember. I mean,
2001. I'll check for you. I know a lot of the answers to the question I'm going to ask you, but I'm just trying to give you the opportunity to be honest. That's why I asked the question. So you bought it in 2001 in Peru.
Okay.
And I asked you if you ever loaned anything out. I gave you scenarios. No. So that's your gun. Either you had that gun or somebody had that gun. Because there's no way that round gets on that property where these 2 girls were killed without that gun being there. And you're there, your car's there, witnesses say
there is no way a round from my gun was anywhere near the girls, the bridge. It just didn't happen.
And listen, we're trying to help you. We're trying to help you prove.
No, you're trying to accuse me of murdering 2 of.
Oh, I don't know what happened there.
No, I think
Calm me down. You asked me a few questions. You asked me what I'm wearing, and I tell you what I think I was probably wearing that day, and then you try to say that I'm saying that's me in that picture, and it's not.
You don't have to say that.
I'm done.
Well, I have a warrant for your
I know
DNA.
you.
For your DNA first. What do you think I have a warrant for? You know I have a warrant. What?
I figure you're going to arrest me. You obviously think I've done it. The damage is done. Go ahead and do what you're going to do.
Well,
this doesn't just go away.
I know.
Exactly.
The only person I think can explain all this is you, and you're not explaining it to me.
I don't know what it is you want me to explain.
What were you doing on the bridge? How did your round get there? And why did you kill these 2 girls? Or why were you involved in this? What was your involvement?
I had no.
I don't think, listen, Rick, I don't think you're the one that killed them. I don't think you're the one that stuck the knife in them. Are you?
I didn't really.
Are you?
No. Anybody that knows me knows I could never, even if I wanted to do something like that. That's not who I am.
Then what happened?
I can't tell you. How do you expect me to tell you? You want me to make up a story and
No, the truth. The truth is simple. You don't have to make that up. You just go back and tell me the truth.
I've
You can't
told
tell me
you.
that this event has not been weighing on you for years and years and years. You were out there.
I've told you that. I don't know what you want me to do at this point. I did not murder 2 little.
I've been so nice.
Oh, let's see.
I've been so nice.
Oh, yeah, you're being nice. You're trying to get me to confess to something I had nothing to do
I'm trying
with.
to get you to tell the truth. I'm not trying to trick you. I've drawn out what we have.
It,
Most of it.
you assume it's the truth, and it's not.
It has to be the truth. The scientists still lie. The science doesn't lie.
That's awesome.
It's saying that
The science doesn't lie. Oh my goodness. Anyway, if you want to see how the science lies, guys, please watch The Myth of the Matching Gun. I think a lot of us already knew that the science was dodgy, but I think when you look into her methodology, it is just, like I said, if I had that methodology on a university project, I'd probably fail it. It's just so far from what the science was meant to say. I'm not against all tool mark analysis. I know that has been questionable, but she does not use the tool mark analysis in the way that it has been validated. Those error rates she quotes are not for the way that she used it. It's ludicrous. Anyway, okay, back to this.
round came from your gun.
I don't understand all that. All I'm telling you is there's a way that a round from my gun, the one that you took from my house, ended up next to a murder scene or.
Okay, so you can see he's obviously getting more agitated. I'm going to skip ahead to his wife, and then we can come back and we'll talk about this.
Yeah. So, all right, babe. It's going to be all right. They're trying to tell me that you actually believe that I did it. And I just can't believe that.
Trying to figure out where there's a bullet out there.
I know. Do you think I'm not? And that's what I told them. I can't explain something I don't understand. I tried to explain to them that there's no way that a bullet from my gun was at a murder scene because it didn't happen. I didn't even have my gun that day I went out.
And I mean, I know we're going to watch the rest of this interaction, Diana, because I've shown this in full here. But it's like he's looking at her saying, please don't tell me you believe them too. Please don't. Like, it's not manipulative the way that the people who believe he's guilty will say, he's trying to manipulate her. It just feels like there's this plea. It's like, please tell me that you don't believe them. You know me. Yeah. It's a really sad interaction. Any thoughts, Diana? Or do you want to just get to the end of this part?
You can move on. I missed the tool mark stuff that you were just talking about.
Oh, I was just having a bit of a rant about, Holman saying the science doesn't lie. Mm-hmm. So, yeah, just reiterating what we talked about yesterday in the live.
I can't stand Holman. It just makes me upset when I hear people say, well, he lied to Kathy, and their conversation in the interrogation or the interview, he admits it. He admits he lied. That's not true.
No, and we do talk about it in this because I got the other psychs to weigh in on this. Anyone who's been listening to me for a while, I have tried to explain this in a previous live. the point I always make is you do not grill your adult partner, friend, sibling, or whoever, another adult about their actions on a day where a crime occurred if you trust them. So if my best friend were on the trails when that happened, I would not ask her, well, where exactly did you go? Did you go on the bridge? Did you not go on the bridge? Where did you, you just don't do that. This isn't a child who's got in trouble at school. This is your husband of decades. So she has assumed he wasn't on the bridge because he wasn't meant to go across the bridge, I believe, because of his heart condition and stuff, and it's dangerous. So she didn't really like him going over the bridge. So I'm going to make the assumption that she just assumed he didn't go over the bridge because he didn't go over the bridge by that point. He says that himself. And she didn't ask him, did you go on the bridge at all? Did you go on the trestle? Did you do this? Of course you don't, because you don't think he's the murderer. You're not going to ask him those questions. I think the fact that she's confused there, she's more worried that she told the police that he didn't go on the bridge and he did go on the bridge and that she's getting him into trouble. She's not worried that he lied to her. She's not saying, you lied to me. Why did you say that? There's not even an ounce in there of her actually thinking he's lied to her. She just looks bewildered. Like, what on earth is going on? I don't understand this. It doesn't feel accusatory, at least not in my impression.
You know me. You know this isn't something I could do. And I know that you know that. You don't have to tell me that, I know. They really think I did this. And they want me to believe that I know you know I didn't do this. I guess that's what I'm saying. I don't know what they're trying to do here, but I'm not going to say something that's not true, and I can't explain something that I don't understand. The only way for me to explain it is that I don't know, because I'm saying it's not possible. There's no way that a bullet from my gun ended up at a murder scene. I didn't murder anybody. I didn't help somebody murder anybody. You know, I'm not going to sit here and try to convince you. I know you know me. I know you know that I didn't do this. Had anything to do with it. Like, talk about scheming or something.
Yeah, I don't. How did a bullet from your gun get out there?
I don't know.
Because they said it came from our gun.
I know that's what they believe me. That's what they're telling me.
But how did it get there?
I don't know.
They said there was one in your box above your dresser that matched it.
They showed me that picture too. I can't explain it. And I don't.
I can't either. They keep asking me and I don't know how to answer that.
You
No way
answer
for
it.
me to know.
I understand. Me either. And that's what I'm trying to tell them. You want to keep asking me and I just keep telling you I can't explain it. I don't know how to explain something that isn't possible. But I know, this is what I do know. I know that no bullet from my gun was connected with a murder in any way, shape, or form. And there's no way a bullet from my gun would have been near Abby and Libby's murder or anything else, because I never even seen those girls. Period. And I didn't even have my gun that day. So that's what I'm trying to say. I don't know how to make that any clearer. I don't know how to make that any clearer. I don't know how to make somebody understand. I get what he's saying. I don't have a way to explain it.
Sorry, guys, I'm just going to show you a little bit more of this because I think this interaction's useful. So it's a little bit longer.
Like there's a witness that said it was you out there.
Dear, I don't know
And I'm
what.
like, how did they know it was you? So So they said they showed her a picture. And I'm like, of course you were out there.
If they seen me out there, they seen me out there, dear. And I
But
told
were
them.
you on the bridge?
I told them I was on the bridge. I went out to the first trestle.
Oh, okay.
That first
I
thing
don't
that.
remember you telling me that. You told me, so I told you weren't on it. But I didn't.
It doesn't, hon, you're not in any trouble. You didn't do anything. I didn't do anything. Huh?
I didn't know you were on it. I'm sorry.
Well, don't worry about it.
You told
Hon,
me you weren't.
huh?
You told me you weren't, so I just was.
No, I told you that I walked.
Okay.
I love you, baby. I don't know what they're trying to do, but I know that that's not what I told you. I love you. It's just, they're not going to get away with this.
So that interaction about what he did or didn't tell her about the bridge is important. I'm just going to skip just one more bit towards the end, and then we'll come back and talk for a couple minutes.
And whatever the fuck happened out there, we'll never fucking know, because you're too big of a fucking.
So
go ahead.
So tell you I did something.
Tell me
that
the
I
truth.
didn't do.
The truth, Rick. I don't want to
I've
know.
told you the truth, and you don't want to hear it.
The evidence tells me otherwise. The evidence clearly indicates you're involved in this.
No, it doesn't.
It fucking does.
It doesn't. I'm telling you that there is no way that a bullet from my gun was used in these murders.
And I'm telling you that we had this fucking round on February the 14th, 2017. It's been secured in a fucking laboratory. And we've tested other guns
I understand what you're saying.
I want her to hear this.
I understand what you're saying. What I'm telling you is I can't explain something I don't understand.
Oh, the scientists explained it for you. The lab analysis and analysts have explained that for you. They're saying that this round, without a doubt, came from your gun.
Then you've taken it from somewhere else then. Because it's not possible.
I did not take it from somewhere else. It was logged in. It was taken as photograph. You think we fucking went and stole your fucking round and threw it down by a fucking dead girl's foot? This ain't fucking TV. This is realistic.
I understand.
We collected that fucking item on February the 14th. We didn't take it from anywhere else but that fucking scene. And we didn't take your gun from anywhere else. We took it from your fucking house.
I'm telling you, I can't explain something.
And I'm telling you, the fucking analysts explain it. You can't get past this.
Can you please let my wife out?
Absolutely. Come on, Kathy.
I love you, baby. Can I kiss her?
Yeah, kiss her. Do the right thing, Kathy.
So I didn't tell the my colleagues about the diagnosis or the diagnoses that were provided by Westcott and Walla. Anyone who's followed my discussion of the psychology of this case knows I don't really agree with this primary diagnosis of dependent personality disorder. I really think that it's first of all, it is not a diagnosis that we hand out very regularly. It's not the most, there's not a high proportion of people that have this. I'm a little bit on the fence about personality disorders in general, to be honest. Majority of the time when we see a personality disorder, it is a trauma-related reaction. Or at least for a lot of them, the ones that we kind of commonly see. This to me is not a person with dependent personality disorder. This is a person who's protecting his wife. He's managing an interview quite well on his own. I mean, well, we say quite well, like obviously he should have a lawyer there, but he's actually stands his ground. He's assertive. He doesn't crack under the pressure. He's not overly concerned with giving the answers people want. So I guess he's a people pleaser because I think he's, like in my perspective, and I know I'm going to probably get a lot of shade for this from the people who believe he's guilty, but I think he's a kind man. And I think he's a caring man, and I think he's a conscientious man. And so, I mean, he's so patient. Even there, he's still patient with Holman. He's getting aggravated, but he is not being as aggressive back to Holman as many people would be. And yeah, I think he just wants to actually look out for his wife. He hugs her, he reassures her, and he does that again in the phone calls too. It just doesn't scream dependent personality to me. What do you think, Diana?
Absolutely not. I mean, is she basing it off of him being in prison, tortured where he shouldn't have even been at that time, and missing his wife? I mean, come on now. And they didn't even let them have any visits, barely got to talk to her. So is that what she's saying her diagnosis is based on? Because, and is that the primary one that she gave him? Because that is ridiculous.
Yeah, so dependent personality disorder, major depression with psychosis. Again, disagree with that one too, because the psychotic episode, yes, it was within the context of him being depressed, but he'd been depressed his whole life, depressed to the point where he's been in hospital because he put a gun in his mouth. We'd never had a psychotic episode before. This is a traumatic decompensation. Yes, it is psychosis. I think if we want to go DSM, it's schizophreniform. I'm not great with the psychotic disorders because I don't really see them. But yeah, I initially said brief psychotic episode, but a brief psychotic episode is 1 month, I believe.
Yeah.
But interestingly, I believe, and I don't know if this, because this is when I think I was watching another channel, but I believe that Westcott says that brief psychotic episode is not in the DSM-5, but it is. So this is what I'm saying. I'm a little bit concerned.
They were using the 4, weren't they?
I don't even know. So I'm a little bit concerned with the psychology in this case because we've got diagnoses that do not fit. And it's this oversimplification of behavior. So yes, he's dependent on his wife when he's incarcerated. Oh my gosh, wouldn't you be? And she relates it back as well to what we spoke about previously, where he can't manage when he's in a high position in a job and he curls up and needs her to support him, and he couldn't be away from them for long because then he lost it. But that's also the sign of someone who has high levels of anxiety and mental health issues anyway. Like, I know, having had a history of depression and anxiety, when you are in an episode, a lot of us would become dependent on the source of support. That's not dependent personality disorder. That is fear, clinginess. I think someone in the chat, I think it was Veronica, said, like, yes, we get clingy. I mean, it could also be anxious attachment. That's a possibility as well, but it doesn't really ring true. I mean, we'll talk about that more in the final part of this series, which is down the track somewhere. But again, I think I got dismissed for saying I didn't agree with Westcott's formulation because of this. But I just think jumping to a personality disorder is actually not a super helpful process. Look, in this case, if it were dependent personality disorder, that doesn't do any harm to Rick's defense because that's negatively correlated with crime. But I also think that I see this infantilization of Rick and this pathologizing of Rick, where what we're suggesting here when we talk about, highly sensitive and neurotype is not pathologizing him. It's saying his nervous system is wired differently. There is nothing wrong with having a sensitive nervous system. In fact, if there were people with sensitive nervous systems, there wouldn't be people like us doing this job. Highly sensitive people are the people who are hyper empathic a lot of the time. Not always, but most of the time, where the people who see and understand things that other people may not on an emotional level. So yeah, I don't know. I felt like the diagnosis of Rick Allen and the fragile egg and all of that stuff, it's not respectful of him. He was unwell. He's not a child, and he doesn't behave like a child. I don't see that in this. I do, during his decompensation, hear childlike aspect. Someone before referred to the call to the dad, and we saw the transcripts show up yesterday around that, and he's saying, "I love you, daddy." And that was around the same time where he's talking to his mum on the phone, and there is a childlikeness about him. But that, again, is a decompensation. That is the trauma. That is a psychosis. It is not his core personality. So yeah, I'm a bit passionate about that because I just feel like it doesn't do a justice to someone to diagnose them with something that pathologizes more than is needed.
I think this is also just an example of a healthy marriage whose each spouse really supports each other, and that's their person. So why wouldn't he, be dependent on her support? That's exactly. Your person.
Exactly. And she's staying strong once he's incarcerated because she has got support around her. You know, I think she's close to his mum, she's got her daughter. So she's on the outside and she's struggling, but you can hear a strength in her that, you know, in the subsequent phone calls and when you see her in the documentary. And that's because she's not incarcerated. It sucks. She's in an absolute world of misery, but she still has some normality around her. And I'm not suggesting Kathy isn't suffering at all. My heart goes out to Kathy, and if Kathy is ever watching any of my content, you know, I absolutely think that I've shown solidarity to her at every step of the way. I think she's a brave, resilient, amazing, empowered woman. Like when I saw her in the documentary, it was just, you know, I was really just proud of how she shows up. But clearly she's not going to be as dependent on him when he's incarcerated, because she's not incarcerated and she has people around her, whereas he's stuck in this awful cell that's tiny, probably smaller than the office that I'm in right now, with lights on constantly, cameras in his face, and being called baby killer. Like, you know, of course he needs his wife and his mum and his dad. So, yeah.
And to be honest, I think the dependent personality diagnosis, that's kind of just a CYA, you know, cover your ass. Because if they gave a primary diagnosis of like a either, well, it was more than brief psychotic disorder.
Schizophrenic, I think, would be the one that would probably apply, I believe.
So if they gave him that diagnosis, then they're taking responsibility for him having the psychosis, because he's never had that in his life. So yeah. I think maybe that was just more of a CYA.
Yeah. Veronica, just reading your comment. Yeah, like, look, I didn't mean to sort of say if you call your dad or mum daddy or mummy that that it's weird. So please don't take that as what I was saying. I was just saying, like, it could be, because I did definitely feel like when I listened to the call with his mum around the April 3rd mark, where things were really kind of starting to go awry, I felt like he had a bit of a childlikeness in his tone. But that doesn't, like, yeah, I mean, that's just speculation. I've just read the transcript, not actually heard that call at all. But yeah, I mean, I definitely think I called my parents dada and mummy up until probably my 20s. I probably don't now, but that's probably because I'm mummy now in my house. That's all. But anyway.
Who knows if you were incarcerated and being tortured for over a year?
Oh, yeah, exactly. And if you think about it, so if we look at the parts models of trauma, when we have had any sort of difficult experiences in our life, we have a vulnerable child part. So we all have that. We call it our inner child. Now, for some of us, our inner child is largely happy and contented, but for a lot of us, there is vulnerability that we hold in that sort of child mode within us. I mean, I have a vulnerable child. She is the lonely child who felt different because of neurodivergence, and I have and I think I have a vulnerable child that feels anxious and worried as well. And that's because of, again, I think it's neurodivergent trauma for me. I haven't really had any other significant trauma, but a lot of my clients will have a traumatized child. They'll have an abandoned child. So when we have a child part, which we all do, that can be reactivated when we're in situations that trigger us again. So if you think about this, if I were incarcerated, my child part that feels different and bad and wrong is going to come up to the surface, and it's going to start to become the dominant part, and my adult part is going to kind of step back. And so this is a parts model. It's not having multiple personalities. Multiple personalities is an extreme form of parts. It's basically the parts are completely fractured, but generally speaking, most of our parts are going to be kind of somewhat integrated, but you will disintegrate when you're in a traumatic situation. And this is when the vulnerable parts will come back up. So I know for me, when I have had some really difficult experiences in my life, the childlike part comes up and it does go, Mum, I need you, mummy, you know. So that's not, I'm not at all, again, not trying to pathologize that. It is a trauma reaction, as opposed to anything, you know, necessarily completely out of the norm. And I think that's what happens to Rick when he's incarcerated. He does take on maybe a bit more of a childlikeness to him, which can look like dependent personality, but that's not pervasive throughout his life. It's when he's in high levels of stress, just as if you're in high levels of stress and you've had any vulnerabilities, that will come to the surface too. So I think the problem is, and this is my understanding, is when you're reliant simply on things like the MMPI and the Millen, you're your diagnosis is based on these sorts of like these questionnaires, and whilst they're very valid in a lot of ways, they're not going to get the nuance. They're not trauma informed, they're not neurodivergent informed, and I think that's where we can go wrong. And this is why I think clinical psychology is so important in the forensic field, because as clinical psychologists, we really pick this stuff apart, right, Diana? Like we call this conceptualization. We don't just do questionnaires on people and say, well, this person has this diagnosis. We spend usually multiple sessions developing an idea of, you know, what sort of factors are at play here, what layers, and yeah, it's a very layered approach. Now, when you're doing an assessment of someone, I guess in the forensic system, you're not going to probably have, you know, multiple hours over multiple weeks with the person, perhaps. But I really think that's kind of what you need in a case like this, because I don't think an MMPI or a Millen can satisfactorily summarize somebody's personality or their characteristics, because it's really looking at symptoms. It's not looking at what are the roots of those symptoms. So the same symptoms can look the very same on the surface, but what causes those symptoms underneath or what contributes to them can be very different. And this is where we get these different diagnoses that look similar, but they're not the same.
Yeah, those are 2 personality tests. I'm really surprised that they administered those. Like, how do they even have access to those since they're so long and probably expensive? I mean, those are super old. Wasn't it the 60s that they came out? 60s, 70s?
Yeah, I don't know. Look, I do think it's the forensic system. I mean, I haven't worked in the forensic system for a long time, but I know that when I did work in the jail, we did do the Millen and they did do the MMPI. I always have a very funny story about this because we self-administered them, and I think it was the MMPI that I did.
God.
I actually scored high on the or low on the validity scale, so about my drug and alcohol use. So the interpretation was that I was lying about my drug and alcohol use because I am a teetotal. I never drink. I don't like alcohol. I've never liked it. But because of my degree of neuroses and emotional ability, it was like, you must be drinking and taking drugs. And I was like, no. I mean, yeah, I've got my drug of choice is Coca-Cola. It's sugar. But I mean, that just shows you, like, you know, that even the malingering scales can be a little bit ineffective. So I think of, again, my son, who I always bring up, but he's like this little angel, right? Like, he really is. And I'm not being biased here. He's like the sweetest little thing ever. I love both my sons. I love my niece too, but this one particular son, he's like, he cannot lie. He wants to save everybody. He walks past a homeless person, he's like, I want to buy them a house. He's drawn pictures for Rick Allen. I haven't sent them to Rick, but he's drawn pictures saying, I know you are innocent, you know, we will help you, and things like that. Anyway, he if you did a scale on him, and the questions sometimes in the malingering scales would be things like, I never lie. I mean, that's actually true. He never lies. Like, he looks like he's malingering because he's just such a sweet kid. So anyway, just an interesting stuff. I do believe that the validity scales can be helpful. And I do think in the case of Rick, you know, they do talk about the malingering scale. And I do think that's useful in this case because it does help to show that, you know, he's not overly biased towards trying to present as more unwell than he is. And this is, again, a misinterpretation that we see in some of the videos that we've discussed before, where they say, well, if he scored okay on the malingering scale, that means he's an honest person, so that means his confessions are honest. That is a
total gosh, that's such a reach.
Ridiculous. The malingering scale is to show you whether that person is you know, trying to over-endorse items of unwellness. It's about malingering about mental illness. It's not malingering about life in general. It's not an honesty scale. So even if we're trying to get at somebody's honesty, that's not the purpose of the malingering scale. It's about honesty around their psychological symptoms. Is this person trying to exaggerate or minimize how they present? And so it has consistency questions. But again, we can talk about that a little bit more over time. So I have lots of thoughts about this, Diana. You can tell.
I would love to see that report, because do you know how many tests she administered? Was it just 2?
I don't actually even think she did the MMPI. I think she just did the Millen, as far as I'm aware, but I'm not sure. She talks about the neuropsychological findings, and this might be where, again, because you said that's sort of an area of interest for you, Diana, because the only 2 things she shares about the neuropsychological assessment is, I think she says his processing speed, I believe that his processing speed was in like the 5th percentile or something, and his problem solving capacity was about, again, one of them was the 2nd percentile, one was the 5th, which is incredibly low, which is where we go back to this man would absolutely, in my opinion, have an average IQ at the least. Right? At the very least, we would be saying he's in that norm group of 90 to 110. He may even be higher. I don't think he's at all a man who has any cognitive limitations. And yet suddenly we're seeing in the neuropsych evaluation, she's not mentioning anything about his overall cognitive capacity, but she's mentioning certain areas of executive functioning being dramatically low. Now that is not explained by anything other than, very serious mental health issues, maybe impacts of medication, brain damage, or traumatic brain injury or post-concussive syndrome, but she doesn't interpret any of that.
Yeah, I would love to see that too. And processing speed and working memory are the 2 out of the 4 sections of the IQ test that ADHDers are scored lower in. So usually then they look for the score on the other index.
Exactly.
And then problem solving, poor guy can't solve his own problems right now.
Right. And I think, again, we're going to see executive dysfunction when it comes to being unwell, being highly medicated, being sleep deprived. But I think that the degree of how low they are, to me, I was worried about TBI as well. We know that he's been banging his head into things to the point where he's black and blue. And I'm sure he's not had any CT scans of his brain. And this is what really, it really upsets me when I even talk about this, because I just think, oh gosh, I hope this isn't permanent damage. I really do, because this poor man, he's already lost enough of his life. But again, this is an indication where I don't like what was elicited in the testimony, because that doesn't make sense in isolation, giving those sorts of information, that bits of information. She talks about perseveration as well, but she also talks about perseveration prior to incarceration, which again, to me, is alarm bells for ADHD, ASD, OCD, because those are the perseverative conditions, the ones where we get kind of stuck on something, we hyper-focus, or we keep checking. And again, did she do a Y box? Did she do an obsessive compulsive beliefs questionnaire? I'm sure she didn't, because that's the stuff I think needs to be done, because not just in terms of, it is important in understanding his confessions, because false belief OCD is a thing. People with OCD can be convinced that they did something wrong. I have clients like this. They have a dream about having, physically hurt someone. They wake up and they worry maybe it was true. I, as somebody who has had OCD my entire life, can tell you that I would confess to a crime I hadn't done if you put me in those conditions. And yet I've never, ever hurt someone in my life. I don't even like hurting the ants when they kind of come up around my cat's bowl and I wipe them away. I go, oh, I'm so sorry, ants. I didn't mean to hurt you. And so realistically, though, you could convince me that I've done something, so it's not just psychosis. It could be OCD and psychosis. And if you put the two together, that would be a wicked combination when it comes to someone like Rick, where he's going to then be like, maybe I did it, and he's going to spiral with guilt, and he's going to become hyper-religious and scrupulous. Scrupulosity is conscientiousness and, morality to the nth degree. And it seems like this is a scrupulous man. And I know that sounds ludicrous to the people who watch this going, yeah, but he's been convicted of a double murder. How can he be scrupulous? But if he's not guilty of this crime, which I don't believe he is, I think he's the opposite of the person that would have committed this crime. I still believe to this day that if Rick had been at that bridge that little bit later, or he turned the other way from that 505 bench, I think this man, I believe, would have risked his life to save Abby and Libby. He's the dad of a little girl himself. Not a little girl, she was older, but he's a dad of a girl. My dad was that sort of man. He's the sort of man where he'd get killed in a situation like this, and we'd be like, why did you do that, Dad? To save somebody else. That's what makes me so sad about this story, because I actually think Rick was just that few minutes on a different time frame, which meant he not only couldn't be there to hope, potentially stop what happened to Abby and Libby, but on top of that, he ended up getting engrossed in it. as well, like, you know, getting stuck into this story. So maybe I'm reaching there. Maybe I'm romanticizing a man that I've never met. I'm not trying to do that, but I'm trying to suggest that I think he's somebody who deeply cares about people. And I think that if he could have helped those girls, I think he probably would have tried.
Mm-hmm.
Anyway, okay, let's watch the last bit of this.
Wouldn't you like to see us?
She knows I will.
Oh, no, sorry, Diana, what were you saying?
I was going to say, wouldn't you like to see some stats on how many murderers and psychopaths love cats? Okay? Because I doubt that they love cats.
Yeah. That picture of him with the big Maine Coon cat, like, yeah, come on. Like, I mean, the other thing I wanted to say as well, about Rick, yeah, like you've got the tool bench with the cat on it. You've got the fact that he mentions Kathy's cat plates on the car. Like, these people love cats. There's a picture of him with the dog. He's an animal lover. He clearly loves his daughter. You see those pictures and he's just beaming with pride, you know, with his daughter. She clearly loves him, because I know people will say, well, she didn't, you know, she's not been around. I actually think he protects her, to be honest. I don't think he's been calling his daughter. I think he's stuck with his mum, his dad and his wife, because his daughter, I believe, had just got married. I think she may have had a baby. He doesn't want to burden his daughter. He says in the call in November of 2024 to Kathy, you know, if you need to move on, I want you to move on. I don't want you to be, you know, stuck. Like, what? Again, he's not saying you stick by me no matter what, I need you. He's actually saying to her, move on, because he wants the best life for his family. He doesn't want them to have an attorney because it's going to waste their money. You know, this is probably why he didn't bring a lawyer in, because he's like, I don't want to waste the money. He cares so much about financial security for his family. So yeah, I don't know. I guess maybe, like, I will always admit that there's a little bit of counter-transference perhaps here for me, because he does remind me a bit of my dad, and and he reminds me of me, and he reminds me of so many of my clients who could get themselves in this position, but they're actually the least likely person to hurt someone. So it's really sad. It really is. Okay, let's watch the last little bit.
You're going to put your family through this for no reason.
Okay, so I'm gonna pop that aside, and we'll finish up in a minute. But yeah, any thoughts on all of those interactions you just saw?
A lot.
Yeah, it's a lot, isn't it?
Yeah, lots of thoughts. Okay, I'll try and keep it brief, but a couple of things. Like, if I'm just kind of looking more from that, you know, objective diagnostic lens, like, from my experience, I often think that if we want to see, you know, if someone is saying that they don't remember something or they don't know something, is that because they actually, you know, is telling the truth that they don't, or is there something psychological that could be impacting on them remembering that, right? There is a difference between people remembering things but not remembering details. That's probably a bit more like, you know, ADHD or, you know, like kind of like different neurotypes. But if someone doesn't remember something happening at all and like really appalled by that, then I would be kind of thinking more about like dissociation. You know, and so what we understand, like, is that dissociation is a whole spectrum. Dissociation can happen when people have had like early life trauma, but there's many things that we need to look at in order to actually consider whether that's a dissociative picture or not, because dissociation doesn't just happen like out of the blue, like, you know, that's kind of like things that you can kind of trace. And I probably won't get into the diagnostic criteria for now, but, you know, in the past, what people call like split personality disorder, you know, now we consider that the term is dissociative identity disorder, and there's a whole range of like dissociative disorders as well. Now, I'm not sure if the psychologist that assessed him has looked at dissociation, but, you know, I would think that that's a very important thing to actually distinguish. Like, you know, is this someone who maybe did something but didn't remember, or they actually, you know, there's no evidence to say that they could have done something that they don't remember. So I do think that that's something that's really crucial to consider. The other thing I will say, and then I'll let Mel speak, is, you know, I guess for me, I don't claim to be any expert around like psychopathy or, sociopathy, but my understanding of it is that, this is kind of where you see that almost like the other end of the spectrum around that, having very low or no empathy versus someone with very high empathy, which is kind of like, that there is a kind of like stark difference there. And it's really important to distinguish that, because I think that, you might see things on the behavioral level, someone denying that they did something, right? And people can sometimes, I guess, jump to conclusions, because we often think, oh yeah, if someone is like, has done something but they are refusing to admit, they would deny. But the thing is that like how they're denying it does make a difference as well. And I think that when there is such an emotionally charged and it really sounds, I mean, even looking at like just all the interactions and how he's kind of like communicating, there's a lot of emotions there. So I will be very, very hard pressed, like for like to actually say that he is kind of like the like kind of low empathy person. So I think that there's kind of some confounding stuff there. And if we think about it, like sort of even from a common man lens, and which is what we think about when we look at like law, right? Like what would the jury say? And it's like, I mean, if you think about it, wouldn't most people who have been accused of something, let's say if we go with the assumption that if I'm innocent, right, and someone's like pushing me and keep saying like, no you did it, and it's like naturally that survival response would go from anxious to then eventually to that point of like what we call like learned helplessness, right? It's like the damn if you do, damn if you don't. Whatever I say is not gonna work. It's like a prey being circled around, and it's like eventually you just collapse and actually kind of just go like, yeah, whatever, this is what it is now. It's better to do that because it's actually more protective, like end the suffering. So that's kind of like the picture I see. But then of course, like from an objective sense, I'll be like, okay, like unless this could be something that the only possibility that this could be someone who is having such a presentation but actually was the perpetrator, is that there was like a severe dissociation that they had totally no idea.
What do you think, Mel?
Yeah, look, I completely agree everything what Ash has just said. You do notice a completely different person, right? This time around, when he's being questioned by the police, he's quite agitated, and rightly so. He's been trying to tell them that he was there. However, he can't explain why the bullet was found there, and he feels quite helpless because he's not being heard and being repeatedly accused. You see the wife also come in, and they are scared. They both are scared because it feels like they've been cornered into this. So that's what's coming across. And like Ash said, look, we don't want to jump to the conclusion that he's lying. Potentially look at reasons that what could be some of the other reasons that he doesn't recollect what's going on there. Or and my question was, I guess, did they find the bullet after they did the house search, or did they find it in the initial?
The bullet thing is complicated because it's really hard to trust a lot of the investigation here, given all of these accidents and missteps. So the bullet that was found at the scene is what they call an unspent round. It means it's cycled through the cartridge of the gun, but it hasn't actually been ejected. And so what they've done is they found a bullet at his place. And some people would say supposedly found it because, it's hard to know. Are things being planted? But even if we say that bullet was definitely there and, it was his and they've seized it, they've then said that bullet matches his gun. Because he has a gun. I mean, and everyone, like probably a lot of people in Indiana have a gun. That's not actually anything unusual. And it's a pretty common gun. So what they've done is they call it tool mark analysis. And I'm going to just do it really briefly now because it's a lot to talk about. But what they do is as a gun is fired, there are extractor marks that are kind of put onto the bullet that are kind of almost like a fingerprint for the gun. And so if you compare, let's say I shoot somebody and then you come to my house and you shoot a bullet out of my gun, those two bullets should show fairly similar marks because the gun has its own little fingerprint. The problem here is that the round that they found at the scene of the crime is an unspent round. So it doesn't have the extractor marks. It has some marks from being cycled in the cartridge, but that's not the full pressure of a gun being fired. So essentially, it's comparing apples with oranges. So tool mark analysis has been just for some comic relief. Yeah, look, I really challenge anybody to kidnap me. You would want to give me back as soon as you took me, because you'd be like, this chick just doesn't shut up. They were like, I regret the day that I kidnapped this person. Please take her back. Like, it's ridiculous. I mean, anyone who wants to say that we deserve to die, or someone in our family deserves to die because we're supporting Rick, like, again, that's just absurd. I do not support somebody who I believe would actually abduct and murder two young girls. I did speak earlier about the fact that I have worked with inmates. I will support people who have done things that are against the law and incorrect, and try to work with them. But I would not work with a sadistic person who lacked empathy, who took two beautiful young girls in the prime of their life and killed them. And I never have. And I would not be sitting here advocating if I truly believed that Rick had done this. He didn't do it. And I say that with conviction because of all of the evidence that we've looked at. I don't say that by just saying, well, I read in a paper he didn't do it, so he didn't do it, which is what you hear a lot, unfortunately, with the people who say he's guilty. I saw in the news he did it. I saw that the bullet matched the gun. Let's look deeper, guys. That's all I'm asking you to do. Look deeper before you make your conclusions. Anyway, I just wanted to say that, guys. Come on, kidnap me, guys. I will drive you nuts, okay?
That's hilarious.
Been validated. It's still something that's somewhat still questioned, but there is a some reliability in it. But that's for a fired bullet and a gun, not an unspent round and a gun. And so, there's more to it than that. But yeah, there's a lot of speculation. The person who did this forensic analysis did it alone. There wasn't a second observer. They do it purely based on looking at it under a microscope for visual checks. And she had to fire. She couldn't just cycle a cartridge, an unspent round, and match it. She had to fire it, but she had to fire it 3 times. On the third time, she got something that slightly matched. Right? So
very generic, isn't it?
It's not the hard science that he's selling it as.
And also, like, if all his life, he's believed that, I just genetically putting it out there that people are out to get him. Well, this is his worst fear comes through, true, in that interview itself. So I feel like there's so much at play here for him psychologically. And that's what you get to see, yeah.
What are your thoughts, guys, both of you, just quickly, because then we'll round up for now, the interaction between Rick and Kathy when she says, I told them you weren't on the bridge, you didn't tell me you were on the bridge. And he says, I told them I was on the bridge, I was on the first trestle, because that's just literally like a few meters out. He didn't go across the bridge because the bridge is long and it's rickety, and he said he wasn't fit to do that anymore. He had in the past. And then she says, but you said you weren't, you told me you weren't. And then he goes to explain, and then he just says, it doesn't matter, you didn't do anything wrong, I love you, babe. And Pete, what's your, like, did you feel like that interaction was a natural interaction? Did it seem deceptive? Did it seem manipulative? What do you think?
I felt that they'd actually given them time to get her, so that she could talk to him, because she really appeared scared and she was crying. And also, it's like they planted a seed of doubt in her head. I don't know. I don't know if I'm jumping to conclusions, but that's how I read it.
Yeah, well, they've told her at this point that an eyewitness has seen him on the trails, which is actually completely false. Nobody, that's actually part of the prosecution's case, that nobody saw him on the trails that day, so he must have gone and abducted the girls and hidden, in the bushes with them. So they've told her a pack of lies, essentially, and her life's been turned upside down. This is a man she's been married to for 20 plus years at this point. Ash, did you see any indicators of what you would think is manipulation or deception or problematic interactions between the two of them?
Not particularly. I mean, I can see why, perhaps I'm just speculating here that some people might, use that to say that, that was him having let slip something, or like, you know, and then going back on his words. But I don't think that's compelling enough. And and again, I mean, I don't know, maybe I'm also just going kind of like, if I kind of like zoom out from that, if we're thinking about someone who commits a crime, like what is happening in this case, it's not a murder by, what do you call that? I don't have the terms in my head now, but you know, when things happen by accident, you know, like when people are fighting, and then what's the term for
like
that?
Like a crime of passion, or like a reactive anger, do you mean?
Yeah, yeah. You know, like if that's the case, then okay, we can kind of look from things at that frame, right? Like things could happen, you know, out of impulse. But this sounds like either, you know, something it's very out of the ordinary, you know, that's why I was talking about possible dissociation, or like a more, you know, sociopathy, psychopathy kind of like side of things, where, you know, or even like psychosis, but from that aspect of like not having that sort of sound mind, so to speak, you know, around doing things like that. So I guess then again, it would kind of say that it wouldn't fit then, you know, like this presentation that we're seeing with him. And the other thing that I was picking up, again, this is kind of just more you know, like when we're looking at something, I'm conscious that, you know, like we can more often, not everyone has their own biased view, right? But what I'm picking up is that like he was actually trying really hard to reassure his wife. Like he was actually kind of feeling really, I mean, even for me, you know, I mean, being quite a sensitive person myself, like it was quite painful to watch that, you know. And if your you know, partner that you love is there kind of really distressed, it's like, you know, and I'm sure because by that time he's really, you know, like tried to express his innocence. That's assuming he believes that, right? Like if he's trying to do that for many years, was it by that time? It's like, it's a bit kind of like, is there a point to kind of say more, you know? So yeah, just having all those things that I'm kind of like.
One of the things that I've raised before about this point as well around, you know, she thought he wasn't on the bridge, he was on the bridge. They basically try to make out that, you know, he didn't tell her he was on the bridge that day because otherwise she would have thought he was bridge guy. So he was being deceptive to his wife. The thing is, he's not deceptive to the police, though. He's told them he was on the bridge. So why would he not tell his wife, but he's telling the police? And then my sense of this is if, and I guess, you know, you guys can speak to this, you know, if your partner was walking on a trail today and came home and you'd found out that someone was murdered on that trail, or like maybe let's say walking on the trail last week and you found that out, and they went and they spoke to the police because, you know, they were on the trail that day, would you grill them like, you know, where exactly did you go on the trail? Did you go on the bridge? Did you see the girl? Like you would probably just like my responses would be like, oh my gosh, that's terrible. What, you know, what did you see, baby? Yes. But, and then I'd be like, oh gosh, that's just, but I would not ask them for a blow by blow. Like if it was, you know, I guess it's like people are expecting a partner to grill their partner about this the way you would grill a child if the school called you and told you that they, you know, were smoking behind the toilets that day or something. Yeah, then I'd be like, well, where were you? Were you behind the toilets? Who were you with? You know, but you don't do that. If you've been married for 20 years, you don't kind of like suddenly ask that. Like I wouldn't even ask it of you guys. If you told me that, you know, that happened to you, I wouldn't be like, oh, but just tell me the truth, Ash. You know, what, did you walk around that way or the other way? Like you just don't do that because you trust the person, right?
Yeah.
Exactly. And you would not ask them like those kind of questions because that would imply that you think they were there for some ulterior motive. In fact, you would be encouraging your partner, oh, look, you know, you should go talk to the police just in case you might have seen something or you could be of help.
Which is what she did back in 2017. And 100%. Like, and the thing is, the fact is that now he was arrested in 2022, he was convicted in 2024, and she's still standing by him. So realistically, if she still believes he's innocent now, she believed he was innocent all those years too. And the only reason in this moment is she's traumatized because she's had all of this thrown at her and been told that they've seen him on the trails, and she hasn't got the full story. They've lied to her. And so of course she's asking those questions. But once she then realizes no one saw him on the trails, the gun science is absolute shonky, you know, junk science, then she's able to like actually go, oh, because I mean, yes, of course, if if a police officer comes to you guys now and says, well, when Amy was at the clinic on Monday night, before she left, she killed her client, and we've got it on CCTV, but they don't show you the CCTV. Of course, you'd be like, well, I trust the police aren't lying to me, right?
Yeah.
Anyway, guys, hold that thought with all of this stuff, because the interaction between him and his wife is important as well in terms of understanding his relationship history, or his kind of the dynamics, particularly when you'll hear some of the confession calls that he makes to his wife and his mum in the next segment. But
Can I just quickly add a couple of questions that popped in my head as I was listening before we end? Look, I think, if you're talking about psychopathy or sociopathy, look, they don't just randomly show up at the 50s, right? And people would have, like, his friends, mother, wife, work would have all seen some signs of that showing up. I'm not saying in that kind of manner, but you would have seen some kind of odd, unusual behaviors.
And the reality is that the decades and decades of tracking serial killers and sociopathic sadistic murderers, because this is a sadistic crime, there's no DNA. Again, this person's been able to evade law enforcement for 5 years. The car didn't show any indication of blood. Yes, they didn't test it for 5 years, but still, sure, he got home, he's on the couch at 5:30 when Kathy comes home that day, and the crime occurred at about 3-ish. So, how did he, as a first-time crime, he's done this, it's a very bloody crime, and he's gone home, got into his car, he didn't have any protective gear on, and then he's managed to not leave any DNA there, and he's managed to get rid of all the blood from the car and his clothes, and he's laying on the couch 2 hours later. But anyway, that's about, the practicalities of it. Serial killers, you'd be hard-pressed to find one that didn't start their crimes in their 20s. They don't start at age 44. That's how old he was at the time of this crime. And there are serial killers that are caught at middle age, but it's not because they committed the crime at middle age. They usually have just gone undetected for years. And there are other indicators in their life. It's the only people who commit their first, violent crime at the age of maybe 44 is usually a crime of passion. You get home and you found your partner cheating and you kill the man who they're cheating with or whatever. They tend to be those types of crimes. They don't tend to be. And I've actually done a search. I've really tried to look for other cases like him, and you're hard pressed to find it. And so ChatGPT, my best friend, calls Rick a forensic unicorn if he is indeed guilty, because it's that rare. One other thing as well, before we finish up, just speaking to your point about dissociation as well. When I first got interested in this case and really kind of wanting to understand it, I did chat it out with ChatGPT, and that was something that ChatGPT raised as well, of, maybe he saw something or was involved in some way and dissociated. I'm trying to go back in my mind of why I kind of let go of that hypothesis, and I'll think about that maybe between now and next time. But it's definitely something to explore. And maybe, we can pick up with that next time.
Yeah. I'll just, sorry, can I just say something really quickly around that? And
sorry,
also,
Any joking.
Writing off now. Sorry, I say that and then sometimes I go for 5 minutes, right? But I was kind of saying that in a way where it's like, that it's actually a good, mental health assessment, like to kind of look at dissociation, because I think it highlights a lot of things and it's going to give a lot of clues. So it sounds like you have looked into that. So I'll be curious to kind of think, to hear what was, what has surfaced from that exploration. The other thing I was going to say is that, so again, now we're looking at, so if we flip the hypothesis, right, the other way around, where so initially I was kind of like trying to look at it from a place of, okay, I don't know, maybe this might be someone who did commit a crime. But then what I was trying to say is that the evidence is not the evidence in terms of how it's presenting is not matching up, just like how we describe, psychopathy, sociopathy, and the type of crime. But the other side of the coin, which is something that Mel mentioned, is that I think that this is actually someone who has very high vulnerability to be the scapegoat, if anything.
100%. Yeah.
With their presentation, because of how they are, someone who is like, very much that try to do their work honestly. Just to an extent, I don't think he has any intellectual disability, but he is quite simple in the sense of like, he wants to live his life like in that sort of seems like that, right? Like and believes things in kind of like a more simple way as well.
I think trusting, right?
Trusting,
like trusting, and doesn't have this expectation of like, he's not thinking about twists and turns and devious ideas.
Yeah, and if anything, even if we want to take from that more mental health side to kind of look at what his vulnerability is, and where I guess risks are, is that, well, this is someone who is actually at risk of being manipulated, at risk of being scapegoated, because that's exactly what happens when someone is highly anxious but very trusting, and often has this like I guess presentation of like wanting to be cared for, but also trying really hard to please other people, to maintain relationships. It's really it's really kind of like at the heart of the kind of person in any kind of relationship, if put in manipulative hands, would be gaslighted, would self-doubt, would decompensate.
And that sounds like a prediction. And just for the listeners here, Ash does not know the details of this case, because anyone listening will be like, have you skipped ahead? No, because you're 100% on that. Okay, that was long, guys. That was a marathon. I hope that was enjoyable, though, to like listen through us all chatting. Ash is a very wise person and has a lot to say. So, she can go into quite a bit of detail, but I really like that about her, because I think she contextualizes a lot of stuff. And Mel was actually a little bit anxious about doing this. She's always like a little bit worried that she doesn't know as much as Ash and I, because she's a registrar, but she is a senior psych. And I think she did an awesome job. I really felt like I had I got even more insights from them, and they kind of pushed me to kind of even like clarify some of my thoughts. One of the things that came up, and I will ask Diana for her thoughts in a minute too, but while I remember it, because otherwise it will fall out of my mind. Ash mentions about, could he be dissociating? Like, could he potentially be involved, but just have dissociated because it was traumatic? And I looked into that hypothesis. I still remember having lengthy conversations with ChatGPT, because it's my best friend, about this, and saying, do you think Rick's guilty? And initially starting off with ChatGPT thinking he was guilty, because ChatGPT just listens to the media. And I convinced ChatGPT to look at it again. And we talked about the middle ground, which could be that he's not fully guilty, but he's involved in some way or saw something. But I ruled that out, because I believe if he were involved in some way and he dissociated, and that's how he's managed to live his life, for 5 years and not remember it or not speak about it, I still think that in a dissociative state, then you would have had a more disorganized crime scene. And there would have been, I still think there would have been more fallout in the 5 years in between. So I don't believe it's a dissociation. I don't believe that he saw anything of value that day that includes him in the crime. I wonder, though, if that's why his interview was suppressed, that maybe they were worried he was a little bit too close to it, because as anyone who's listened to my timeline analysis will see, I believe that Rick leaves at around the time the girls arrive, and he sees the sedan and the SUV at the Mears entrance, and to me that's Kelsey German pulling in. He says there could be people around the car at that time. He definitely speaks about those two cars. So my feeling is that he may be sitting on that bench, the 505, when BG walks past. He may see he may see some other cars around. If he did park at CPS, for example, he may have seen the old car, which I think is part of this crime. I wonder if law enforcement were worried about what he did see, and they needed to make sure that he had less detail in his statement later on, which is why he was ignored. Kind of like how we've got the recorded over 2017 interviews of Betsy Blair and Bree Wilbur. Now, again, this is all speculation, but I don't think that they have the early interviews of those people either. So we're missing a lot of eyewitness testimony of people who were around the scene of the crime. And so my feeling might be that if this is some sort of cover-up, then anyone who was actually around the scene at the time potentially could have given details that that actually gave clues to finding the real perpetrators. And I think Rick could have been one of those people. So my assessment of this is that Rick is someone who they didn't want to get a lot of information from at the time because they can't manipulate Rick. Rick is not involved in any crime circles. He is an honest guy. And so if he did see anything of value back in 2017 that could have implicated the true perpetrators that potentially are being covered up for, that that wouldn't be in their best interests. And I think that could be one of the reasons as well that he was not re-interviewed. I mean, their interviewing of people in this case was insane. I mean, they interviewed Cheyenne Mells after she kind of needed to push them to do it, and they only interviewed her once in 2017, and then it was 10 minutes worth, so a really short interview. It just seems like they didn't actually really want detailed statements from the people who were around the area at the time. Many people said they had to go back and insist that people heard their statements. I believe Betsy Blair says that about the sketch, and I believe Brad Heath says he kept contacting them about the old car. It's interesting, isn't it, the things that they just didn't seem to care about following up on, and we know that's the case with some of the other third parties too. So yeah, I don't think that Rick dissociated and was involved in any way and was setting it up or anything like that. I think he's completely unrelated. I don't believe that he's just dissociated and forgotten it for 5 years. I don't think that that's a reasonable hypothesis here either. Diana, thoughts? Any thoughts in general before we wrap up? Oh, we can't hear you, Diana, for some reason.
Oh, oops. How about now? Now? Yeah, I think that the dissociation was good to rule out. I definitely don't think he was dissociating because I think he's innocent, obviously. but
and I think if he dissociated again, you imagine some sort of spillage, wouldn't you? You know, like over the 5.5 years. And also you would then not expect it would take another 6 months of incarceration before he finally cracks open and shares these ridiculous random fragments of confessions. So yeah, I don't buy it.
And wouldn't that be in his mental health history as well,
And you bring up a good point there, actually. One thing I was going to say, and I mentioned this in the myths video last week, where a lot of the people who believe he's guilty will say he's a sex addict and an alcoholic. Well, that's obviously not in his medical file because Westcott does not refer to it in her testimony. And if that were the case, wouldn't the cross-examination from the prosecution have got her to elicit that information? There is no indication of any sex addiction or alcohol addiction. Would he have drunk? Probably to deal with his mental illness, probably, but probably no more than a lot of the other Midwest men, as well. So I think I find it really unusual when people try to say he was that, because he said it in one unrecorded confession to Walla. There is no other evidence that he's a sex addict. He had a healthy marriage. There's nobody that's come out of the woodworks to, throw shade around him, where you do hear this in other cases where, suddenly one mistress comes up and then someone else comes up. There was nothing like that. Bye, Veronica. Good on you for working out. I was going to go to the gym, but I've nearly run out of time today. Probably won't go again. Thank you for joining us, Veronica, and thanks for your support. I really, really, really appreciate it and your kindness. So, thanks for joining our discussion and join us again soon.
Bye, Veronica.
Yeah, Diana, continue. I can't stop myself. I need to mute.
I didn't get to hear your last bit because I had to take my kid potty, but if you were just talking about the dissociation, I mean, I heard that you said that you ruled that out, and I would too.
Yeah. So, I mean, I guess that first section was quite lengthy with Mel and Ash because they don't have any background. I think if Diana and I had done that just ourselves, we would have been a lot quicker because we have a lot more of the case background, and I'm not trying to hide from Diana, what diagnoses were given. So at this point still, Ash and Mel do not know what diagnoses were given by Westcott and Walla. And the reason I've done that is I'm going to get right to the end. So the next part is them listening to some of the phone calls, and we start talking about the Walla confession. And I haven't told them enough about Westville. It was a bit tricky, actually. I didn't feel like the second part is organized particularly well. I think like if I did it again, I would have sort of had a bit more structure, but we're talking about that. And then the third part will be where we get the final kind of ideas from them around like what they would write if they were writing a report, what conceptualizations they would come up with and what diagnoses, so they can pull out their DSMs and give us some ideas as well. But yeah, at the moment, I think one of them mentioned at one point in this, maybe it's the next one, about some dependency, but I don't, again, not on the level of dependent personality disorder. So I think that's a real takeaway here. And I also don't believe the psychosis is part of the depression. Yes, he was depressed and psychotic at the same time, but in major depressive disorder with psychosis, you would have expected other times in the past over 50 years where he would have had a depressive episode that became psychotic, but there is no history of that either.
Right.
So to me, this is a psychosis within a traumatic decompensation as opposed to that. But I think this is where we get too prescriptive with diagnostic criteria because, schizophreniform apparently was like, again, it's not something I've ever diagnosed before, but that applies in this case. But it's not a common diagnosis that we throw around, which is why I think a lot of us would just say it's a brief psychotic episode because we forget about the timeframes. I don't know a bit about you, Diana, but I'm not really overly fixated on DSM diagnoses. I'm more concerned about conceptualization and treatment. So the diagnostic criteria, it's more like, okay, he had a psychotic episode within the context of decompensation and trauma, as opposed to sort of saying, well, it matches this exact criteria.
Yeah, I think that it's the first time this light bulb has went off for me, but I totally think that they were trying to just cover something up with that dependent personality diagnosis.
One other thing that's topical at the moment, Diana, because I saw a little bit of this on X yesterday. So with the release of some more of the exhibits, we have seen this transcript of a conversation with Rick and his dad, which happens, I think, the day before the conversation with Kathy, where he confesses for the first time, or the first recorded confession. And there's been some speak around people saying he believes he's poisoned. He's sort of saying they're poisoning me. If I say something I don't believe it, and things like that. Any thoughts from you? Like, I think I err towards more this being a psychotic decompensation, and he was pushed into this by the conditions. I don't believe deliberate drugging would have occurred. I'm not saying it could never occur, but yeah, what are your thoughts on that?
Well, yes, it does occur. Someone that I'm close to, just happened to them, and they put them in the padded cell for like 7 days, and but when they drug tested them, there was no drugs in their system. But he said that it was totally them trying to poison his food somehow.
So it can happen.
It does happen.
I think that there is naivety on my part. I do think Australia, our system is different. I mean, we have a very different government here at the moment to what you guys have, and I'm not going to get political here, but I think our system is quite different. Having worked in the jail system, yes, there are some pretty abhorrent things that go on, both with inmates upon inmates, but also some officers that, and staff that aren't ethical. But by and large, that wasn't my experience. So working in a maximum security, facility, a very large facility, I have to say that I was generally pretty impressed with how our inmates were cared for. And yeah, I didn't see any indications of any abusive actions of staff towards inmates. And yeah, sometimes inmate to inmate, but even then we would be on it quite quickly, and we would make sure those inmates were put in protection or put in an area that was safer for them. And one of the things I know in our case, so we would get remand inmates. So they would be people who were not convicted, but they were on remand like Rick was. And we would put them into either a remand area or a protection remand area. They didn't need solitary though, because I remember in our protection area that we had, there was like guys that were in for like vehicular manslaughter, like they were like your dad next door that had probably, drunk drive and accidentally killed someone. And that's a crime and that's horrific. But, there'd be these people that were not going to go and attack someone or they were usually people in kind of positions where they would help other inmates, or we'd have have the guys who, you know, had got themselves involved with the wrong crew and maybe had an intellectual disability, or we had a lot of vulnerable people, and in that area, that's where we would put someone probably like Rick. Like they'd probably test him out in an area like that, where, you know, so they wouldn't have left him in solitary for all of those months on end. The only people in segregation and solitary were people who had been violent towards others or a risk to others, and they would only be in there for a short period. We would go in and do reviews. And then in terms of suicide cells, same thing. Like I think probably the longest I can remember someone being in a suicide cell would have been a week. You know, we would really find ways to try and get them back out, whether it meant, you know, getting them in with another inmate. And you knew the inmates who you could trust. You really did. You could do an assessment. There were always people in any jail, whether it's max security, minimum security. There are guys in there that are trustworthy. They've still committed crimes, but they, you know, you can kind of have this assessment of who's going to, you know, brutalize a vulnerable person and who's not. So yeah, I just think our system here is a bit different, and I think particularly probably in certain states of the US it would be worse than others too, right?
Indiana is the worst of the worst for sure.
Well, it's interesting because I'd said, like, if Rick does get a retrial, I was thinking of like coming to go to the retrial. I'm like so invested now. My mum was like, "You are not going." She wouldn't be allowed into the country because her social media is absolutely against what is allowed these days in the country. So I won't.
Are they checking people's social media before they let them in?
They do. So, you know, I have a sister who is you know, a pro-Palestine, like she's anti-torture, like she does like a lot of advocacy work and human rights work. So she would not be let in. And then my mum is a troll on Twitter. I tell her this. She's not a troll for me. She's not mean, but she definitely does like troll certain political views. I won't mention them because I don't want to get my social media in trouble. But yeah, so then I was like, well, how am I going to go? Like, I can't take my little kids. And my niece is like, I will come, but she's little too. But she loves the case. She's very into Delphi because she spent 2 months with me during like the peak of all of this. She knows all of you guys. She, Diana, she knows your little secrets. You know that? Only joking.
Oh, that one. Mm-hmm.
She knows Prof. She like watches Prof. She knew that Prof was like Santa sticking up for me and stuff like that. So she's really into it.
10?
She's like, I will come. Yeah, she's 10. She's like, I'll come. I don't know if my sister will let her, but if I do come, if there is a retrial, I know it won't be for a long time. I hope one of you guys will come and be my bodyguard. I'm a bit scared.
Oh yeah, I'll go.
Yeah. But yeah, I mean, I guess I'm a white supremacist, right? So I should be fine.
Oh yeah.
No, I think I'd feel pretty vulnerable there, to be honest. Like, I don't think I'd feel particularly safe being an ethnic woman who is supporting Rick Allen in Indiana. I think that would be, I'd need a bodyguard. Shippy, you going to come meet me in Delphi?
I'll go. I can meet you over there. And my whiteness will protect both of us. You know, I'm very, very bright white over here.
Exactly. Dino, okay, Dino can come. Well, here you go, you guys. If you're my mods here, you got to be my mods in real life too. So you're gonna dress up in like big black suits and follow me around, okay? I'll be a celebrity by then, right? Like with my growing YouTube following of 220 people. I mean, the people are gonna be like paparazzi around me, right?
You might need some real bodyguards, you know. Listen to what happened to
I'm sexist here, Heavy. You'll be my protector too. Sorry, I shouldn't just be relying upon the men.
Didn't you hear about the ladies that had went to eat? It was the PI Christine and I don't remember who else, and they saw some trucks circling the restaurant and they had to go out through the back and everything. Yeah, it's pretty scary.
It was Christine who made me recognize just how scary it would be there, because I was like, oh, it's a nice pretty little town, I'll go there, because I just think of like, you know, you guys saw me walking on the trails here in Australia, and it's like I'm not saying no crime happens in Australia. We're not like, we're the land of convicts, remember? But no, I mean, I do think like the US is a different level to Australia. We are very protected here. Crimes like this don't actually happen very often here. There are not a lot of cases to cover here in Australia, to be honest. Yeah, they're few and far between, and racism is not particularly strong here, certainly not in the areas that I live in either. You know, there would be no no white supremacist gangs. I mean, when I worked in the jail system, funny story here too, one of the inmates who loved me, who wanted to see me every time he came back to our jail, which was a lot of times, he was in the white power gang. And I remember seeing it on his intake going, well, should I be the one seeing him? But after I saw him, he used to request to see me. He'd want to come back to the jail to be my client.
Aww.
And it wasn't in a creepy way. I mean, there were some creepy ones, but this wasn't. He really liked me. Clearly, I think some of them just joined the white power gang for
protection
status.
in prison.
Exactly, because I had quite a few of them that were in the white power gangs, and I'm clearly ethnic.
White
I mean,
power gang.
people can't tell what ethnicity I am. Like, I think a lot of people get confused. I am Indian. If anyone wanted to know that, I'm North Indian. But but people can tell. They think I'm either like Persian or Lebanese, or sometimes I get South American. But I'm clearly ethnic. There's no doubt about it. And I didn't get any racism within the jail system, even though you do get those sorts of gangs and stuff. So anyway, interesting. I've always got like interesting stories, haven't I, about all of this stuff. That was a really cool time. I worked with another psych actually when I was in the jail, who had worked at the Supermax jail, like the one where you do get some of the more well-known Australian offenders. I won't mention too much because I guess it's all confidential, but she had worked with people you would have seen in the news. I in my time, I've worked with a few people where they would have been in the news, but they weren't they wouldn't have been highly discussed. Yeah. Oh, thank you, Mimi. You protect me too. That's lovely. We've got our little gang, right? I really do feel I really want to thank everybody here. Like, you guys are my little gang of people who I trust. And I really, I'm so glad I met you guys, because I really wanted to give up on Delphi before I met you guys. And it was just this trickle effect, I think Prof's chat was where I met a lot of you guys, and Diana, though I absolutely owe a lot of my success to you, because you took me under your wing and put me on your live chatting away like I do right now, and I just was going on, and then Shibby and Hebby got involved, and Carol and Al and the Prowl and Quad Axel Mimi, and I hope I haven't missed any of you guys, because you're all of you have been so beautiful. I really truly love you. And when I said before that the Richard Allen Justice Project is us, if you guys want to be in that project, it's absolutely you guys. It's you guys make this. I wouldn't have this platform if it weren't for you. I honestly wouldn't.
We're so glad that you didn't drop out. I remember the day that you were right there. You were giving up.
So dramatic that day as well. Oh, and Charles. Charles isn't here today, but I do have a soft spot for him. We disagree completely on this case, and but I know that he is really he is caring, and he does support me, and I really appreciate that too. So there's lots of lovely people, and I wish that people didn't have to be mean to each other at all. I really would like everybody in this community if they're all nice to each other, but I'm not going to support people if they're going to be nasty about other people. We don't have to agree. I don't agree on everything that the people who I say, but I still like them because they're good people. And they're good to me, and they have integrity, and that's all I'm looking for, really. So but this group, you guys have become my firm friends. Sometimes I'd rather chat to you guys than go out.
So. Well, this was really fun. I loved hearing their perspective. It's kind of like a game of guess who or something.
It really felt like that. It was it felt like case conference. But I was thinking, if we had a better production team and stuff, I think that would be a really good documentary. People would love to hear, psychologists going through the evidence. And I really have thought to myself, doing the Richard Allen Justice Project, I've really started to think I don't know if this already exists, but I really think that psychologists could be included as in innocence projects, not just as expert witnesses, but as people to review case files and bring together all of the information. I'm not an expert on tool marks or geofencing, but I am an expert on research methods, and I am, good at educating people about complex concepts. And I think that's where psychologists, we have that systems thinking. We have that capacity to pull things together, but also explain it in a way that is more digestible to the general public. So I imagine maybe one day getting, doing some advocacy work with something like the Innocence Project. Maybe the Richard Allen Justice Project, once Rick is free, can become a justice project for others in the same position as Rick, I hope, because it's so meaningful. I feel like in doing this, it's changed my life as well. Like, I really do. Like, I felt like there are times in my life where I can feel kind of purposeless. Like, I have 2 beautiful kids and my niece, and that's always a purpose. And I have all my clients. But, sometimes I'd be like, I always wanted to do more. I've always wanted to like continue to like do more and more and more. And like in this, like being involved in this feels like I could actually make an impact, like along with all of the rest of the crew. So I'm not trying to claim, that I'm the only one that's going to do it. But yeah, I think Rick Allen himself in this case has brought a lot out in me that I hadn't been able to put out there before. I've always wanted to do YouTube about a variety of different things. I've never had the confidence, and it's something about this case just got me, and it's all kind of fallen into place. And yeah, I hope that it pays off for Rick too, though.
Oh crap. I'm laughing over here. I got distracted because Coaraxo Mimi says, ain't nobody gonna mess with a group of peri or postmenopausal women.
So true. And you know what, quote Axel made me like, I would say that I'm menopause on steroids, right? Because I have no estrogen in my body. And I can tell you that does not do good things to my body and my mind, right? Oh my gosh, like complete crash into menopause. And so I can be a cranky bitch at times, particularly when I'm coming down off my decks as well. Oh my gosh, terrible equation. But I mean, look, I think, like I said before, when Vincent was trying to troll us, I think that they're not going to want to mess with me because they'll be like, she just doesn't bloody shut up. So get me in a room with Terry Holman. He'll be like, he won't be like, I won't be, oh, I'm like getting caught up. I won't be like Rick going, okay. I'll be like, let me tell you, Mr. Holman. I'll keep chatting to you over and over again until you're driven mad.
That would be great.
I would love to see what those men think of me. I'm sure that they could not stand me.
They're poor wives. That's all I have to say. They're poor wives.
Yeah. Anyway,
this is loads of fun.
I know it was a long live stream though, so I really appreciate you for sticking it out, and good on your little one for being so patient and letting you do this as well. Mine wouldn't be. They would have been in the background now. They so want to be in these videos, and I'm like, no guys, you're kids. You can't be in the videos.
Aw, so cute. I mean, yeah.
Well, it's a shame. One day they'll be my big kids, and they'll take over the baton and do the justice work for me when I'm old.
You could put little masks on them.
Yeah, like Avatar's faces. Yeah.
No, like actual Halloween masks.
Oh yeah, maybe on Halloween I'll let them do a little video when they're all dressed up.
Yeah, that'd be cute.
Yeah, they're actually starting a private YouTube channel that's about Minecraft, but I've said that it has to be private. They're not they can share it with their friends, but nobody else.
Oh, that's so cute.
I mean, I can share it with you, Diana, I'm sure, but it won't be platformed on Daisy Asks.
That's adorable, so cute.
All right, guys. Anyway, this has been long, so thank you so much. We will do stage 2 and 3, or part 2 and part 3, but that's probably going to be in a few weeks' time now, because goodness, we probably don't need another 3 hour. I'm going to do a few videos over this week on Doolan's interview tip and going through that. And I think there was something else I was going to do, but I've forgotten now. Oh yes, I've got to do the Hoosier Harvest Store camera footage and do a presentation that I've been working on for that. So that'll be later this week probably. Just to keep the momentum going. But sorry if I'm like filling the feed with lots of videos. Hopefully they're enjoyable. Sometimes I will repeat. I'm just trying to gain more and more people seeing it. So sometimes I repeat things to make sure that people are seeing.
That's smart. Oh, and thank you for the beautiful website. It's so organized. It's very transparent, unlike, some other websites.
Yeah, and I added the video to it. I don't know if you guys saw that. Like, I made a little video with my voiceover. I felt very proud of myself. I managed to edit my voice so it sounds a little bit like a podcast. Again, just to humanize it, I do want to add some videos about Rick and about why I'm so passionate about it and things like that. But yeah, it's meant to be your resource for the context around the evidence as opposed to the evidence itself. So I'm not going to be posting documents and things. You've already got the GitHub for that, but it's more around contextualizing it for particularly for us ADHD people who want everything in a neat presentation rather than having to read 700 pages of testimony, because gosh, my head really hurt from that.
Wow.
I can't believe so many people have stuck around for the full 3 hours. Like, good on you guys. My goodness.
Amy, this is like a drop in the bucket compared to how long a lot of the live streams go.
True.
I think my record is 9 hours, and the last person standing was Quad Axel Mimi.
Oh God, Axel Mimi's got a lot of patience and time on your hands, hey. Thanks Chibi and Heavy and Dino as well, my wonderful mods. You guys are amazing, and of course Diana as well. And thanks to all of you guys that watch and lurk and like the videos. It's so exciting every time I wake up in the morning and I see more likes and subscribers. And, like, it really makes my heart feel full. The kids are like doing a little ticker of how many we've got. When we got to 100, we were like, yay, because we sat on 99 for ages, and now we're at like 220. It's like, what? Like, I know it's a drop in the ocean compared to Mr. Beast. My kids still think I'm going to get, what is it, the blue tick or something? Or no, what is that? That's something that you get, like, if you get like 100,000 subscribers or something.
I'm not sure.
I'm like, don't worry, guys. We're probably not going to achieve that. But if 220 people listening to me, I'm like, that is amazing. I can't believe it.
So thank you to the trolls for making her more popular.
Yeah, thanks, Vincent. And who else did we have in here earlier? I mean, their comments were quite funny. I kind of enjoyed them. Sometimes I enjoy a bit of a troll because they make me laugh. Anyway, okay, guys. Well, have a great evening. Have a great rest of the weekend. I've got to go pick up my boys and get ready for a week of work again.
Oh, yeah, because you're in the future. That's true.
It's 2 p.m. I got to pick up the boys at 4, so I'm going to do a little bit more work on some of the stuff for the website, and then I'm going to go pick them up, and I'll see you guys soon. Bye.
Okay, thanks, Amy. Bye, everybody. See y'all at Dave's. Yes.